Mic test, mic test, mic test. Do you hear me, Bob? 1, 2, 1, 2.
There he is. Yeah, Joe. That's right. It'll be with me forever. Yeah. It'll exist in the cyber world for my great-grandchildren. Well, that's where we can totally be flexible on this compared to Where's Henry? Henry's here. Good. That's nice. Bring me.
Chewing tobacco. Chewing tobacco has always been a part of baseball.
I started when I was in 5th grade, and I've been doing.
Chewing tobacco.
Call the meeting to order. Today, the subcommittee is having a hearing on the prevalence, well, I should say the title of it is Smokeless Tobacco, Impact on the Health of Our Nation's Youth and Use in Major League Baseball. And I'll recognize myself for an opening statement. The subcommittee is examining the prevalence of smokeless tobacco products, diseases linked to the use of these products, and the correlation between smokeless tobacco use by youth and Major League Baseball players. This is an important issue of long-standing interest to this committee, and it's my hope we can continue to raise awareness about the dangers of smokeless tobacco and shape future discussions both in Congress and in Major League Baseball. There are various names for smokeless tobacco. I have to say I haven't even heard of all of them. It's called spit tobacco, chewing tobacco, chew, chaw, dip, plug, and probably many other things unknown to us in this room. But in all forms, the tobacco sits in the mouth while the user sucks on the tobacco juices, spitting often to get rid of the saliva that builds up, allowing nicotine to be absorbed into the bloodstream without even swallowing. But no matter what name you call it, its use is clearly dangerous to your health. In the United States, both smoking and smokeless tobacco has long been associated with baseball. In the early days of the 1900s, baseball players chewed it to keep their mouths moist on dry and dusty fields, or they would spit it into their gloves to soften up the leather and even use it to prepare the notorious spitball. Then during the 50s, smoking tobacco became the product of choice. In fact, when baseball games were first broadcast on TV, cigarette ads became prominent features. Smoking was such a part of Major League Baseball that fan loyalty in New York could be identified merely by what cigarette brand an individual smoked. In the 70s, things shifted again as the public became aware of the dangers of smoking, and chewing tobacco crept back into baseball. During that time, the smokeless tobacco industry used celebrity baseball players as models in their advertisements, sent free examples to clubhouses in the major leagues, minor leagues, and colleges, and ramped up efforts to reach a more youthful audience. As a result, sales rose by 55% between 1978 and 1985. Since then, smokeless tobacco use by baseball players appears on TV screens across the United States 7 months out of the year. It doesn't seem too much of a stretch to consider that kids associate tobacco use as part of the game, and perhaps even believe that it's part of the game that enhances an athlete's performance. I could easily imagine a child thinking, well, last night Yankee Nick Swisher hit a home run with a wad of chew in his cheek. Maybe I can do that too. And the hero phenomena is a powerful mania that can have profound effects on our children. My own concern is that smokeless tobacco use in baseball presents a public health risk that extends beyond the baseball players themselves. Millions of teenagers and young adults in the U.S. use smokeless tobacco. The most recent survey results indicate that over 13% of high school boys and over 2% of high school girls currently use smokeless tobacco products. In fact, surveys by the Centers for Disease Control and Prevention have found that among high school boys, usage rates of smokeless tobacco increased by 22% between 2003 and 2007. Now, we all know that tobacco causes cancer no matter how it's absorbed by the body. Smokeless tobacco is not a safe alternative to smoking, and I'm worried that message is not reaching the youth of our country. A 2008 study by the World Health Organization's International Agency for Research on Cancer concluded that smokeless tobacco users have an 80% higher risk of developing oral cancer and a 60% higher risk of developing pancreatic and esophageal cancer. And despite bans of smokeless tobacco in college and the minor leagues, there is no ban on it in Major League Baseball. So I look forward to exploring the reasons behind this exception. I am also anxious to hear from our witnesses about their recommendations on how Congress can better address this public health issue. And I'd like to thank all of our witnesses for being here today. And I'll recognize the gentleman from Illinois, Mr. Shimkus, for the purpose of making his opening statement.
Thank you, Mr. Chairman. I ask unanimous consent that my full statement be submitted in the record.
Without objection,
all
so
my colleagues.
ordered.
And then I'll just briefly summarize. First of all, I want to welcome Graren Van Buren, who's from my district. He's a young man who will be testifying about the damages of smokeless tobacco, and appreciate his testimony and his advocacy. Tobacco use is bad. I think we all know that. In America today, we need to continue to tell the message. As a young kid who wanted to be a baseball player my whole life, of course, we get to do that still here in Washington with the congressional game, but athletes, all Americans are role models to somebody. And professional baseball has to understand that they're a role model to the next generation of kids. And we want to encourage that good leadership by example style. And I also want to mention and welcome Joe to the committee room. I'm a St. Louis area member of Congress residing in Collinsville. So as a St. Louis boy, we want to welcome you to the committee. He's still remembered fondly throughout Major League Baseball, but especially in his hometown of St. Louis, Missouri. We had a master settlement with the tobacco companies that should have paid in $206 billion over 25 years. The Government Accountability Office states that only 30% of the settlement funds went to health care. Travesty number one. Only 3.5% of the funds went to tobacco control, like smoking cessation and other educational programs. So when money was provided in a settlement to the states to do what we're talking about today, government didn't do the job. Government always overpromises, and we always underdeliver. And the master settlement is a perfect example of not delivering on a settlement with with the tobacco companies. We have a lot of issues here to face. In healthcare, we recently passed healthcare bill, 3,000 pages. There's already fixes that need to be done, whether it's the pre-existing conditions for kids, left out till 2014, whether it's the doctor fix, which still hasn't been done, with the cuts physician payments starting this month. It's going to try to be extended maybe a month. Can you imagine running a business on calculations of income on a month-to-month basis? That's what we should be dealing with our time today. Addressing the healthcare needs of the country, applauding the work that's been. I'm not suggesting that using the bully pulpit to continue to say that tobacco use is bad is not a. I'm not saying that it's not a good use of time. I think when we're in an economy that's people are calling the Great Recession, and we're looking at ways to create and expand jobs, government underfunding healthcare delivery in this country, or taking away Medicare Advantage from seniors, or cutting $500 billion from Medicare, there's probably a more critical use of our time. And with that, Mr. Chairman, I yield back my time.
Chairman Waxman.
Thank you very much, Mr. Chairman. Last year that we passed a law out of this committee that finally was signed by the President, the Family Smoking Prevention Tobacco Control Act, and it grants FDA authority to regulate content, advertising, and marketing of tobacco products in order to protect the public health. This legislation marked a critical step in the long history of efforts to reduce tobacco use by teens. And we've seen progress. Teen smoking rates are down, and while we still have a long way to go, at least that trend is moving in the right direction. But there is one exception to this improvement. That's smokeless tobacco. With smokeless tobacco, the trends are moving in the wrong direction, and the tobacco companies know it. Throughout the 1980s and 90s, the use of smokeless tobacco by teens declined about at the same rate as cigarette smoking. But over the last few years, the decline in smokeless tobacco use has stagnated and use has increased. Last year, smokeless tobacco use among 10th graders reached its highest level since 2002. This is a serious health risk. The increased use of smokeless tobacco will mean millions of more teens getting hooked on nicotine. That's why I want to thank you, Chairman Pallone, for holding today's hearing. We'll hear from some of the nation's leading experts in the smokeless tobacco use, learn about its risks, learn about how to stem the rising tide of use by young people. Two of our witnesses are not new to this committee. In 1994, when I was chairman of the Subcommittee on Health and the Environment, I chaired hearings on the health effects of smokeless tobacco. At those hearings, we heard from Dr. Connolly and from Joe Gargiola, both of whom will be testifying today on the second panel. Mr. Gargiola's 1994 testimony discussed the same subject we'll focus on today, the impact of tobacco use by Major League Baseball players and how it influences young people. We appreciate the work they've done for decades now to reduce the use of smokeless tobacco by kids and Major League Baseball players. Unfortunately, Major League Baseball and the Players Union have yet to take decisive steps to end this terrible scourge. Some progress has been made. In 1993, Commissioner Bud Selig banned smokeless tobacco in minor league clubhouses and dugouts. And therefore, baseball no longer allows tobacco companies to provide free samples to players. And the league and the union continue to educate players and fund efforts to reduce tobacco use by youth. But at the major leagues, at that level, there continues to be no restrictions on the use of smokeless tobacco by players. This means that millions of young fans are exposed on a daily basis to the use of smokeless tobacco by their heroes. The camera shots are relentless. A recent study by Dr. Connolly's colleagues at Harvard found that in just one game in 2004 World Series, ball players provided $6.4 million worth of free advertising for smokeless tobacco. If you're a Major League Baseball player and you're chewing tobacco, you can bet that many thousands of young, impressionable ball players are watching you chew. Too many of them will take up the habit to be just like you. That's why Major League Baseball and the Players Association need to take action to end the use of smokeless tobacco by big league players. We're not saying they should ban the players from using it, but not to use it when they are in public, when they're on the field. We don't let baseball players in the leagues go stand out there in the field and drink beer. The Major League Baseball won't allow them to stand in the field and smoke cigarettes. So why should they be out there on the field in sight of all their fans on television and at the ballpark using smokeless tobacco? I think that baseball has the opportunity to protect players' health and protect the health of millions of young adults. This committee will continue its vigorous and ongoing oversight of these issues. When the Major League Baseball and the union get together and negotiate the next contract, I hope this will be on the table. I don't know why there would be an objection from the Players Union to have the same rules for Major League Baseball that apply to minor league baseball, where they don't allow the use of smokeless tobacco. The protection of young Americans from the ravages of tobacco in all its forms demands no less, and Major League Baseball and its players must step up to the plate to do their part. Thank you, Mr. Chairman.
Thank you, Chairman Waxman. I neglected to thank you in the beginning, but I want to now for all that you've done over the years to, bring to light the problems with smoking in the industry and championing and sponsoring the legislation that's the, that has the FDA regulate tobacco use. So, you're going back to the 90s and you've been doing this for so many years, so I just wanted to mention that. Next is the gentleman from Kentucky, Mr. Whitfield.
Thank you, Mr. Chairman. Today's hearing is titled Smokeless Tobacco, Impact on the Health of Our Nation's Youth. And I don't think any of us object to this type of hearing because it is imperative that we explore this issue. But I think it's also important, and I wish that we would be having a hearing on some mechanisms that are already in place that could probably do more on addressing this issue than this hearing would do. And what am I talking about? Well, first of all, I do want to mention that on March 19th, 2010, FDA reissued its 1996 rule, and this rule becomes effective on June 22nd, 2010, which will prevent the sale of smokeless tobacco and cigarettes to those under 18 and prohibit distribution of free samples of smokeless tobacco as well. But what am I talking about? I think this hearing that we should be focusing on, for example, the language that was in this stimulus bill. And one of our complaints about some of that legislation was the fact that none of us really knew what was in it. But now we're finding out, for example, that in the stimulus bill, there was $650 million appropriated, made available to carry out evidence-based, clinical and community-based prevention and wellness strategies. So the federal government is already giving out money to states if these states will use that money to address certain things like sugar in drinks, tobacco products, and so forth. And yet none of us really knew anything about that, and I think it would be beneficial to all of us if we could get into that in more detail. Second thing is the House also, when it approved the health care bill, not only did we authorize, but we appropriated $5 billion between 2010 and 2015, and then $2 billion a year forever on programs that would allow states to submit application for grants from the federal government. And in those grants, they're doing things like saying that they're going to increase taxes on certain products, that they're going to be involved in zoning and where, for example, tobacco products or other unhealthy products could be marketed. They're also even talking about reducing the density of fast food establishments. And what does that actually mean? Are we going to be determining where fast food restaurants are located? So while this important is vitally worthwhile, I think our time would be better spent on examining thoroughly what happened in the stimulus bill and the health care bill and the money appropriated for that relating directly to this issue. Thank you.
Thank you. The gentlewoman from California, Ms. Eshu.
Good morning, Mr. Chairman. Thank you for holding this hearing on the health impacts of smokeless tobacco, especially its effect on the young people of our country, which I really think is goes to the heart of this issue. This committee has spent a great amount of time examining the health risks of smoking, and I'm pleased that we're focusing on this issue of smokeless tobacco today. While cigarette smoking has declined substantially in our country, which is very good news, especially in the last 10 years, smokeless use has decreased only slightly over that period. This suggests that smokeless use is not a substitute for smoking, but instead is adding to the number of tobacco users. Increased education and awareness about the health risks of smoking, along with tougher regulations, have led to a significant decrease in smokers in the United States. This has been a Herculean effort, and I think it really signifies real progress. As the tobacco industry sees sharp declines in sales, it's obvious that they're looking toward alternative products to hook young customers. Smokeless tobacco is inconspicuous. Kids can use it at school or in class without causing much attention. Smokeless tobacco is also a gateway substance because kids who chew it are 3.5 times more likely to start smoking cigarettes. Both R.J. Reynolds and Philip Morris have introduced snus products, a less messy version of what chewing tobacco used to look like. These small contained mesh packages are placed just under the upper lip, making it more difficult to detect and eliminate the need for a spitting cup. It really sounds pleasant, doesn't it? While the research is not definitive, many claim that smokeless tobacco is less harmful than smoking. A recent 60 Minutes investigation on the use of smokeless tobacco claims that because tobacco manufacturers are not allowed to advertise that it's any safer than cigarettes, their ads focus on smokeless tobacco as a way to get around smoking bans, using smokeless tobacco in the subway or at work. I think that smokeless tobacco is a serious health hazard. I think we have to do more to prevent young people from forming these early addictions, and I look forward to hearing from our witnesses today, most especially from former Major League Baseball player Joe Gargiola Sr. It's really an honor to have you here and to see you. I'm a great fan of yours. And to understand how our nation's role models can set good, healthy examples for the younger generation who look up to them. Thank you, Mr. Chairman, and I look forward to the testimony.
Thank you. Next is the gentleman from Indiana, Mr. Boyer.
Thank you very much. First of all, I'd like to express my disappointment that no one from the Center for Tobacco Products is here to testify today. And now that the center is up and running, we do not have a single witness from what is to be the premier tobacco regulator in our country. So I'm very disappointed, and I have the sense that the center has been deliberately disregarded in this hearing. I continue to remain very interested in the issue of smoking cessation in our country. Chairman Waxman and I feverishly debated this matter last year, and I continue to follow the science behind smoking cessation with hopes we can share valuable information with 45 million Americans who continue to smoke today despite strong public health campaigns that have been in operation for 40 years. We know that today over 70% of the tobacco users want to give up smoking, and treatments for the diseases related to tobacco are costly for our country. However, according to the Surgeon General's report in 2008, of the 45% of smokers who reported trying to quit in 2008, only 4 to 7% were successful. And I believe that that is failure. And what is really disappointing is that the bill that was passed locks America into a system of failure. Americans have no access to information about the alternative methods of smoking cessation. For decades, we've left them with the understanding that they must either quit smoking or die. However, this is not the only option for them, and there is a vast schism in the public health community that is crying out for the FDA and government officials to acknowledge the scientific research which continues to show that individuals throughout the world are finding tremendous success through harm reduction strategies. Yet we continue to ignore harm reduction strategies with regard to smoking. Oh, we'll apply them to everything else in life, but not to smoking. And I think that's pretty ridiculous. If we continue to employ harm reduction strategies and give Americans this information showing the respective risks of tobacco products ranging from cigars and cigarettes to smokeless products and eventually pharmaceutical smoking products and complete cessation, we can give Americans who cannot or will not quit smoking new options to obtain the nicotine that they are dependent on or from products that are up to 99% less hazardous than cigarettes in terms of risk of tobacco-related illness. We must acknowledge the growing public health community that is acknowledging the differential risk between cigarettes and non-burning tobacco products, including almost 80 peer-reviewed scientific and medical publications over the last 25 years, of which 4 of them, Mr. Chairman, I'm going to ask to be submitted for the record. The FDA stated on its website that it will perform its duties by using the best available science to guide the development and implementation of effective public health strategies to reduce the burden of illness and death caused by tobacco products. In carrying out its responsibilities to implement the bill we passed last year, while neither the FDA nor the Center for Tobacco Products are here to testify, I look forward to asking the CDC and NCI about their initiatives to incorporate the latest science into our nation's tobacco control programs so that we can most effectively reduce death and disease attributed to tobacco. I yield back.
Thank you, Mr. Boyer. Next is the gentleman from New York, a big fan of Major League Baseball, from what I remember, Mr. Engel.
Well, thank you very much, Mr. Chairman, for having this important hearing today to examine the prevalence and use of smokeless tobacco products, the health effects from use of these products, and the correlation between smokeless tobacco use by youth and Major League Baseball players. It's fitting, Mr. Chairman, that we hold this hearing in April as our nation has once again embraced the start of the baseball season. I represent the Bronx. I'm from the Bronx, and I grew up less than half a mile from Yankee Stadium. And I love the Mets as well, so I know how much joy the game can bring for so many families, including my own 3 children. I can't even count how many games I've brought them to, and thank you, Mr. Chairman, for remembering that I'm a big baseball fan. And these players, rightly or wrongly, are someone's kids are fascinated with for their athleticism and accomplishments for being the best of the best in baseball. Kids are like sponges, soaking up everything around them, and whether or not it seems subtle, they pick up on one of the more unfortunate aspects of baseball, which is the prevalent use of smokeless tobacco. Today we have reports that up to a third of Major League players report using this highly addictive drug. Smokeless tobacco puts people at risk for oral cancer, gum disease, heart attacks, cardiovascular disease, and cancer. It also causes leukoplakia, a disease of the mouth characterized by white patches and oral lesions. I want to commend Major League Baseball for trying to proactively help our players and in turn the kids that look up to them through their efforts. The 1993 minor league tobacco policy has banned the use and possession of all tobacco products by club personnel and by players in minor league ballparks and during team travel as well. Major League Baseball established a national spit tobacco education program called NSTEP to curb the use of smokeless tobacco products through public service announcements featuring popular players and education and treatment programs for players. But there is a major gap in MLB. While personnel are barred from smoking with a uniform in view of spectators, they can still chew tobacco. MLB has said that this policy is one that the Players Association has sought to protect in collective bargaining. I'm concerned that the Players Association continues to contend in their written testimony today that baseball players should not be prohibited from using substances that are legal and available to the general public. Mr. Prouty has even said that it is impossible for most fans to tell if players are using smokeless tobacco while playing baseball or in the dugout. I have to say I'm disappointed in this response. There have been well-documented instances of players on TV being clearly shown to be using smokeless tobacco. In fact, in one World Series game in 2004, at least 9 minutes of such footage was shown, so kids do see it. And secondly, while smokeless tobacco may be legal, there is a difference between players who want to use it in the privacy of their own homes and when they're on TV being paid very generous salaries to provide entertainment to millions of families each night. Every workplace has rules about what their employees can and cannot do, such as a matter of respect for the institution of Congress. We have to wear suits and ties or other appropriate attire when on the floor of a house. So therefore, it seems quite fair and reasonable that players abstain from using smokeless tobacco on the field, and I urge the Players Association to continue to consider these facts. I want to welcome Joe Garagiola, who is one of my personal heroes, and the other people testifying today, and I thank you, Mr. Chairman.
Thank you, Mr. Engel. Next is the gentleman from Georgia, Mr. Gingrey.
Mr. Chairman, thank you. According to a 2007 CDC study, 20% of high school students smoke cigarettes and 8% of them use smokeless tobacco. While smokeless tobacco may not be as prevalent among teenagers as cigarettes, it can be no less damaging to their health. All forms of oral tobacco have chemicals known to cause cancer of the mouth, pancreas, and esophagus. Oral and smokeless tobacco also cause many other health problems, such as gum disease, destruction of bone sockets around the teeth, and eventually tooth loss. All of us here today have experienced the pain and the loss that comes with the onset of cancer. The mother of one of my staff, her name is Mrs. Margaret Horn, was diagnosed with leukemia a year and a half ago. There are many like Margaret in communities and cities across this country that will face cancer in their lifetime. It's a deadly disease and one for which a cure is long, long overdue. It is with this thought in mind that I want to thank Chairman Pallone for his interest in this subject. Even one death from cancer is one too many. Today we understand the impact that advertising and pictures can have on our youth. Early movie stars of the 20th century made smoking so fashionable. I even remember seeing ads in magazines like Look in Life, where there would be physicians in their white coat and the stethoscope in their pocket. They kept it in the pocket back in those days. They didn't drape it around their neck, but they would have a cigarette in their hand. It was just amazing, and I'm sure all of you have seen those ads. And, of course, there are some baseball players who will always, in part, be remembered for the amount of tobacco that they could stuff into their cheek. Like anyone up on stage, heroes can be memorable for the big things and for the little things they do. With any impressionable child comes the chance they could emulate their heroes. To deny it is to deny the importance that our heroes are to us as adults looking back. The number of people on both sides of the dais, of the committee members, paying tribute to Joe Garagiola. I do the same. I remember when I was a kid growing up and following, and I love catchers. I never played catcher, but I love to follow the career of Joe Garagiola and Clint Courtney and, of course, Yogi Berra. So, you know, we all look back on our heroes and look up to them. If smokeless tobacco was not something readily associated with baseball players, I don't believe that bubble gum today would be sold in packages that resemble these tobacco pouches. When I was a kid, that's not how you got bubble gum. So in short, there's an obvious correlation between the two. I do want to make one point in light of all the testimony that we're going to hear today. I do not doubt that children may look up to baseball players or movie stars. However, I think it is fair to say that parents can and should be their greatest heroes. There will be many things in life, many choices that our children will face, many influences they will have to weigh. It's the parents who have the greatest opportunity, ability to educate our children about things, not only tobacco, but alcohol and drugs and a lot of bad behavior. With this thought in mind, Mr. Chairman, I'd like to encourage this committee not to forget the role that an informed and engaged parent can have on the health of their children. I look forward to hearing from both panels of witnesses. Thank you so much for being with us today.
Thank you. Gentlewoman from Colorado, Ms. DeGette.
Thank you very much, Mr. Chairman. And I've got to say, I completely agree with the gentleman from Georgia about the role of parents. And that also is my view, that parents need to have a strong oversight over their kids. But also, in addition to that, I think the gentleman will agree with me on this too. Study after study has shown that advertising influences for tobacco and tobacco products are particularly strong among minors. And in the past, in the many hearings that this committee has had, we have seen the effects of advertising by tobacco companies on minors. In fact, in my home state of Colorado, the tobacco industry is spending $171 million per year. And they will say that they are not targeting that at minors, but as we've seen in many hearings, much of that advertising is accepted by minors. I will also say, being the parent of two young daughters, teenage and young adults, I see that we have to revisit these issues with every generation. My older daughter, who's in college now, tells me that she's seeing many of her friends who are highly educated, intelligent young people smoking and using smokeless tobacco because they think it's cool. And so we have to revisit these issues generation after generation, and we have to make sure that the people who these kids look up to are not using tobacco products with the assumption that they are okay for the kids. I'm especially concerned about the smokeless tobacco because in places like Colorado, kids now are told from an early age that smoking can kill them. But in many areas, the kids turn towards smokeless tobacco because they're not getting that same message. And so I really look forward to working with Major League Baseball and with all of my colleagues on this committee to make sure those same messages are getting out to kids and to make sure that our role models for these kids, including baseball players, are also giving that consistent message. My younger daughter, who's 16, is the biggest Colorado Rockies fan who exists. Her whole room of her wall is filled with posters of these players, and it's pretty cute to me because she's a girl. But she loves these players. She looks up to them as her peers and her friends, and she goes to every game and scores. And so I want to make sure she gets the right messages from them, just like I want to make sure she gets the right messages from anybody else who's appealing to the teen market.
Thank you. Gentlewoman from Tennessee, Ms. Blackburn.
Thank you, Mr. Chairman. Welcome to all of our witnesses today. We're pleased that you are here, and we appreciate the time that you've taken to prepare your testimony and be with us. Mr. Chairman, I'll have to tell you, I do find it a bit perplexing that we are here once again to discuss youth tobacco usage when I've offered my bill, H.R. 1432, as an amendment in this committee, not only this Congress, but also last Congress, to address this very issue. And unfortunately, that request has fallen on deaf ears. But we have had it here in committee and in subcommittee and looked at this during the markups in the 110th and the 111th Congress. H.R. 1432 is a good government piece which focuses on strengthening existing programs to prevent illegal tobacco use. The bill strengthens the existing work that states and localities are doing to reduce underage access to and use of tobacco products through the evolution of SINAR, a current successful and effective program to lower teen smoking. The legislation takes the next step in the evolution towards protecting youth and informing the public regarding tobacco products. Mr. Shimkus mentioned the use of the MSA funds, and it would have required states to use at least 10% of those MSA funds on smoking cessation and prevention programs. In addition, it would require the states to enforce their laws prohibiting the sale of tobacco products to minors or risk losing 40% of their federal substance. So when you say, those of you on the other side of the aisle say you're not sure about what to do, let me tell you, we have some things that have been offered, and we should be doing them. And I do feel that if the Democrat leadership was serious about reducing youth tobacco usage, surely there would have been thoughtful debate given to that legislation. But yet we're going to blame Major League Baseball for the ills of youth smokeless tobacco usage. So let's be clear. If the MLB wants to change its policy on smokeless tobacco, an agreement will be reached between the MLB and the MLB Players Association. As the former president of the Middle Tennessee Lung Association, and as a grandmother with a 23-month-old who gets up every single morning and says, "Go outside, play baseball," it's his favorite thing to do. I am fully aware of the risk of youth usage of tobacco. I just find it a little bit of grandstanding that you have passed not only in the 111th Congress, but also in the 110th Congress to take action, and at a time when we should be dealing with a budget that the Democrat leadership does not want to deal with, and when we should be looking at the problems that have already been found with the health care bill that passed, we are here once again addressing this issue when the solution is clearly in front of you. I yield back.
Next is the gentlewoman from California, our vice chair, Ms. Capps.
Thank you, Chairman Pallone, for holding this extremely important hearing. I wish to introduce for the record two important statements from our non-governmental organizations, one being Legacy and the other the American Association for Cancer Research, in support of this hearing.
Without objection, so ordered.
It's common knowledge that tobacco is unhealthy, dangerous, and deadly. While we as a nation have taken great steps to reduce tobacco use, especially cigarette smoking, we should all be alarmed by recent studies showing an increase in smokeless tobacco use among young people. In my field of public health, I'm especially concerned that smokeless tobacco products are somehow seen as a safe alternative to cigarettes. We know conclusively that tobacco is an addictive substance in any of its forms, causes numerous types of cancer, gum disease, oral lesions, and increases one's risk of cardiovascular disease. What's worse is that some of these health repercussions can occur within just a few years of use. Tobacco companies have a history of targeting its marketing campaigns to children and youth, encouraging them to start using their products at an early age. One particularly effective strategy was to get celebrity baseball players to endorse and use their products both on and off the field. We continue to deal with the negative repercussions of this today. I commend the work that baseball has done to curb the use of smokeless tobacco. I salute you for that. In particular, the ban on its use in the minor leagues was a bold step to improve the health of both their players and the public. Despite these efforts, Major League Baseball continues to be a venue where smokeless tobacco usage is glamorized. At best, it is free advertisement for the tobacco industry. At worst, it's putting the lives of America's children at risk. On a personal note, I've seen how my own grandchildren look up to athletes with such admiration. Children and adolescents watch these games to see their heroes compete. They try to mimic their throws and their swings. What else will they copy? Well, I sincerely hope that children who look up to baseball players can learn to filter out the negative messages they are receiving about smokeless tobacco use. You know, they really shouldn't have to do that. So I look forward to hearing from our witnesses today and appreciate the fact that you are here, and I yield back my time.
Thank you, Ms. Capps. The gentleman from Texas, our ranking member, Mr. Barton.
Thank you, Chairman Pallone. There's a famous poem about Casey at the bat that starts out, and I'm trying to quote it from memory, so if I miss it, I apologize to those that know it by heart, but it says, "Somewhere birds are singing, somewhere people shout, but there is no joy in Mudville, mighty Casey has struck out." This is a hearing that appears to have struck out before we've even started it, Mr. Chairman. Not that I don't like baseball. I love baseball. I remember when Joe Garziola was actually a catcher for the Pittsburgh Pirates. That shows how far back I go. So we're glad to have him here. I'm not a big fan of tobacco. I've never smoked a tobacco cigarette. I've never used smokeless tobacco. I don't allow smoking in my office. That's been a policy since I got elected in 1985. So I'm not an apologist for the tobacco industry. I don't accept and never have political action contributions from tobacco companies. But I don't see the need, Mr. Chairman, on this particular hearing the way it's structured. We have passed a law regulating tobacco products. I didn't support that law. Under that, the FDA has issued rules prohibiting the marketing of tobacco products to people under the age of 18. Their rule has been put on their website. It appears to me to be pretty explicit and fairly exhaustive in its attempt to prevent tobacco products getting to our youth. There may be a few Major League Baseball players that are under the age of 18. I'm not aware of any, but I guess it's technically possible. If a major leaguer wants to use a tobacco product, he still has that right under our Constitution to do so. If that product happens to be smokeless tobacco, he has the right to use it. And so far as I know, there is not a prohibition against them, a Major League Baseball player being a sponsor or somehow a spokesperson or being used in an advertising campaign for that product. Again, I'm not defending the product, but even under the new law, it is a legal product. So we're going to have a hearing today, Mr. Chairman, where we appear to be trying to intimidate Major League Baseball into prohibiting or discouraging their players from engaging in either the use of these products or serving as spokespersons and in some sort of an advertising advocacy situation for those products. I think that's a misuse of the subcommittee's time, Mr. Chairman. I think we'd be better spent if we begin to investigate and oversee this recent mammoth 3,000-page health bill that's now the law of the land. I was given yesterday a draft, a 55-page draft of the mandates and the timelines in that bill that are now law. There are many mandates that become effective date of enactment, which is March the 23rd, 2010, that are already not being honored by the Obama administration. I think our time would be better spent, Mr. Chairman, if we begin immediately to see what the pluses and minuses are of the new health care law and spent less time appearing to do a grandstand hearing simply because opening day was a couple of weeks ago and people are beginning to focus on the diamond and what activities are going on in Major League Baseball. I do thank the witnesses for appearing. I know you're here sincerely to express your position and that there are issues to be addressed. I don't think it should be the subject of a congressional hearing at this point in time. With that, Mr. Chairman, I yield back.
Gentlewoman from the Virgin Islands, Ms. Christensen.
Thank you, Mr. Chairman. When we passed the Family Smoking Prevention and Tobacco Act, we did so to control and hopefully reduce all tobacco use. So I want to thank you, Chairman Pallone and Ranking Member Shimkus, for holding this hearing, because we're seeing companies trying to redirect their marketing to the smokeless tobacco market, and it's important to remind everyone that smokeless tobacco is also addicting and has harmful effects such as oral and throat cancer and increased risk for esophageal, stomach, and pancreatic cancers, as well as heart disease and stroke. So smokeless tobacco is by no means a safe substitute for cigarettes. Therefore, the increasing use of smokeless tobacco among anyone, but especially today's youth, is quite troubling to me as a physician, a mother, and a grandmother of a 3-year-old who is now in T-ball. The history of smokeless tobacco use in Major League Baseball only exacerbates the problem in today's youth because of the influence that athletes, celebrities, and entertainers have on them. However cool, exciting, or glamorous these athletes or celebrities may seem, there is nothing cool, exciting, or glamorous about the harmful effects caused by using smokeless tobacco that could impair or cut short the potential of a young person before they even get the chance to experience all that life has to offer. The bill we passed and the President signed will restrict marketing and advertising of tobacco products near schools and playgrounds beginning this summer, as well as implement other limitations, but that is not enough. We do appreciate the actions that the minor leagues have taken and look forward to stronger action from Major League Baseball and to working together around this act and any additional legislation or initiatives that will work to reduce and prevent the use of smokeless tobacco and all tobacco in today's youth. We appreciate our witnesses being here. We'd like to welcome also especially Joe Garagiola, and we look forward to the testimonies. Thank you. I yield back.
Thank you. Gentleman from Utah, Mr. Matheson.
Thanks, Mr. Chairman. I'll waive my opening statement.
Sure. Gentleman from, Mr. Green. He's not here. Gentlewoman from Illinois, Ms. Schakowsky.
First of all, Mr. Chairman, I want to thank you for holding this hearing. It is never a waste of time for us to focus on health risks that are posed to our children and to have a thorough discussion over what may be done either within this Congress or outside of in order to make sure that our children are protected. We know that on March 31st, President Obama signed the PACT Act into law, and this new law is a huge step forward in our fight against the underage use of tobacco products and was built on decades of advocacy and public outreach. And I applaud this victory, but I know that we have much work ahead. Big tobacco is still finding its way into the lives of our youth. I think everyone in this room knows that chewing on tobacco is just as dangerous as lighting a cigarette, and we've heard over and over what those risks are. But we've also started to see a resurgence in the use of these products among young people, particularly among young men. And prevention is an ongoing process, as my colleague, Congresswoman DeGette said. Every generation, we always have to keep repeating this. As I was preparing for this hearing, one of my wonderful interns, Michael Kotler, told me stories about his college baseball team. Half of his team used tobacco products. Most of them would chew but not smoke. And according to him, the players chewed during games, not off the field. His experience tells me we still have work to do and that a big chunk of the responsibility to stop the use of tobacco products by underage kids comes from the role models that they look up to. And every time I watch a baseball player spit before stepping up to the bat, I know there are young ball players who dream of becoming pros who see those images too. According to the Harvard study of public health, just one World Series game in 2004 had over 9 minutes of free advertising for the tobacco industry because of shots of players chomping on chew. I mean, you know, sometimes it surprises me that this is looked at as attractive in any way, but apparently to young men, it does look very cool and authentic. Smokeless tobacco is not a healthier substitute for cigarettes. It destroys lives and kills just as effectively as its smoked counterpart. There's been an incredible grassroots effort to educate the public about the dangers of smoking, and we've seen a significant reduction in underage smoking because of it. Without that same commitment, I worry that young people, like my intern's baseball team, will see chewing as an okay substitute for cigarettes. I applaud the minor league tobacco policy, which has taken smokeless tobacco out of the clubhouses and ball fields of the minor leagues. We're going to need that same type of aggressive action at the major league level if we're going to get tobacco products out of the game. And I yield back.
Thank you. Gentleman from Texas, Mr. Green.
Thank you, Mr. Chairman, for holding the hearing on smokeless tobacco and the impact on our nation's children and youth in Major League Baseball. Each year, millions of teenagers use smokeless tobacco, according to the CDC. 13.4% of the U.S. high school boys and 2.3% of high school girls currently use smokeless tobacco products. Youth prevalence data from the Centers for Disease Control also shows that while cigarette smoking has declined substantially in the last 10 years, smokeless use has decreased only slightly over that period. The CDC found that among high school boys, usage rates of smokeless tobacco increased by 22% between 2003 and 2007. There's a perception that smokeless tobacco is a safe product, and we should be clear that studies have found that smokeless tobacco can contain as many as 28 different carcinogens, and smokeless tobacco causes oral cancer, gum disease, and increased risk of heart attack, cardiovascular disease, and nicotine addiction. The World Health Organization's International Agency for Research on Cancer conclude that smokeless tobacco users have an 80% higher risk of developing oral cancer and 60% higher risk of developing pancreatic and esophageal cancer. Smokeless tobacco can be an alternative to smoking cigarettes and may be perceived as safer than smoking cigarettes, but there are still significant health risks associated with smokeless tobacco. Today, we're discussing the use of smokeless tobacco in Major League Baseball and how that impacts our youth. There's, like my colleagues, there's nothing more American than baseball. I'm a fan of the Houston Astros. I actually worked there. I had the ideal job for a seventh grader. I could sell soda water and earn $10 a night and see all the baseball I wanted. In fact, I skipped school to be able to go to opening day when we had the Colt 45, so I remember it very well. But we still have to provide the leadership from the players. Major League Baseball has banned cigarette use by Major League players in uniform and in view of the public has been banned for over 3 decades. However, there are no restrictions on the use of smokeless tobacco. Steps have been taken to restrict smokeless tobacco use by players in uniforms in minor league baseball, but these measures have not been in place in Major League. We do know that in 2003, approximately 36% of the baseball players in the league reported using smokeless tobacco. These players are idolized by our children and seen using smokeless tobacco. We certainly do not want to encourage our youth to begin using a harmful product because they see a sports hero using it. I look forward to the testimony of our witnesses, and Mr. Chairman, and I yield back for our time.
Thank you, Mr. Green. Next is the gentleman from Georgia, Mr. Barrow.
I thank the chairman. I'll waive an opening.
Thank you. I think that everyone has had an opportunity to speak.
Mr. Chairman.
Yes.
I asked you see that my statement be submitted to the record. Would that go for everyone? And
Yeah.
We'll,
without objection, ordered that every statement would be, every member's statement in full would be submitted for the record if
Thank
they
you.
so desire. Okay. We're now going to turn to our witnesses, our first panel. I want to welcome them. Let me introduce the two of you. First is Terry Pahacek, who is Dr. Terry Pahacek, who is Associate Director for Science for the Office on Smoking and Health within the Centers for Disease Control and Prevention. And on my right is Dr. Deborah Wynn, who is Deputy Director for the Division of Cancer Control and Population Sciences with the National Cancer Institute. Thank you both for being here. You know the drill. We have 5-minute openings that become part of the record. And, of course, we may, if you like, you may, in the discretion of the committee, submit additional statements in writing for inclusion in the record. We'll start with Dr. Pahacek. I want to make sure I pronounce it properly. I hope I did get it right.
Mr. Chairman, Ranking Member, and distinguished members of the subcommittee, thank you for the opportunity to participate in this hearing. My name is Dr. Terry Pahacek, and I'm the Associate Director for Science in the Office of Smoking and Health at Centers for Disease Control and Prevention. Today, I will provide an overview of smokeless tobacco, including health effects, trends in product use, and use of smokeless products and their marketing. I want to begin by emphasizing a very important point. There is no safe form of tobacco use. The use of any tobacco product is hazardous to health. The only proven way to reduce the staggering toll that tobacco use takes on our society is to prevent people from ever starting to use tobacco and to help those who already use these products to quit as early in life as possible. What is smokeless tobacco? Smokeless tobacco products come in 2 forms, chewing tobacco and snuff or ground tobacco. In recent years, a new generation of smokeless tobacco products has entered the U.S. market. They include snus, a form of moist snuff, and dissolvable products such as lozenges, arms, sticks, and strips. The questions and national surveys that I will cite in this testimony generally ask respondents about the use of smokeless tobacco products without disaggregating information by specific product types. The scientific evidence clearly shows that using smokeless tobacco products is hazardous to health. They contain at least 28 carcinogens and are known to cause oral, pancreatic, and esophageal cancer. Some studies have also linked smokeless tobacco use to fatal heart attacks and to certain adverse reproductive outcomes during pregnancy. Like cigarettes, smokeless tobacco contains nicotine and is highly addictive. As individuals use smokeless tobacco over time, they typically change products they use to get more nicotine. In doing so, they may be increasing their exposure to carcinogens and other toxic agents. The National Survey on Drug Use and Health, or NSDUP, which is conducted by the Health and Human Services, Substance Abuse and Mental Health Service Administration, indicates that about 3.5% of persons in this country aged 12 and older, or approximately 7.8 million persons, use smokeless tobacco in the past month. Men are more likely than women to use smokeless products. In fact, the highest prevalence of smokeless tobacco use in recent years has been among young adult men. Therefore, this testimony will focus on recent trends related to this population. The NSDUP survey reported a significant increase in smokeless tobacco use among persons 12 years and older, from 3% in 2004 to 3.5% in 2008. During these years, patterns of use among persons 26 and older have remained relatively stable at about 3%. Patterns of use among adolescent girls and women have also remained stable at a very low level. The observed increase primarily comes from an increase among men 18 to 25 years of age, especially in two demographic groups. Among non-Hispanic white men, rates increased from 13.6% in 2003 to 15.4% in 2008. Among Hispanic men aged 18 to 25, rates of smokeless tobacco use increased from 1.9% to 3.4% during that same time. Recent data from Monitoring the Future also confirms an increase among young males, with the rate increasing from 15.8% in 12th grade boys in 2008, up from 11% in 2007. Data from CDC's 2009 Youth Risk Behavior Survey, which will be released this summer, also is showing significant increase in smokeless tobacco use since 2003 among both male high school students overall and non-Hispanic white high school students. As with smoking, most smokeless tobacco use begins during adolescence and young adulthood. Data from NISTA show that in 2002, about 950,000 Americans 12 years and older used smokeless tobacco for the first time. By 2008, that number had increased to 1.4 million. Almost half of those first-time users were under 18, and almost 3/4 were male. Traditionally, cigarette smokers and smokeless tobacco users have been fairly distinct groups. However, several national surveys show that a large proportion of smokeless tobacco users are also smoking cigarettes. This pattern is most common among adolescents and young adults than among older Americans. In fact, the data indicate that 2/3 of males between 18 and 25 who use smokeless tobacco also smoke cigarettes. These trends need to be placed in a changing context of tobacco use in the United States, including lower smoking rates, increased restrictions on smoking in public, and increased social acceptability of smoking. Mr. Chairman, am I over my limit?
You are, but you can wrap up if you like.
Okay. So the marketplace has been changing, with the promotion of tobacco products increasing from 200 million in 2005 to 300 million in 2006. In particular concern is that many of these new smokeless products are being marketed in ways that's for smokers to satisfy and sustain their nicotine addictions when they're in settings that do not allow smoking. So what is the public health harm? This dual use raises potential concerns. More than half of adolescents and young adults who are using smokeless tobacco also are smoking cigarettes. I have submitted my written testimony, which provides greater details on these important issues, but it's important to emphasize that recent increases in smokeless tobacco use by adolescent boys and young men, as well as increasing dual use of cigarettes and smokeless tobacco, are a reason for serious concern. Together, these may portend a leveling off or even reversal in the decline of smoking and a perpetuation of nicotine dependence, including high levels of tobacco-related disease and death in this country. I thank you for the opportunity to participate in this hearing and be happy to accept questions.
Thank you, and thank you for being mindful of the time, too. I appreciate it. Dr. Nguyen?
Thank you. Good morning. I'm Deborah Nguyen, Deputy Director of the Division of Cancer Control and Population Sciences, National Cancer Institute, National Institutes of Health. Thank you, Chairman Pallone and distinguished members of the committee, for the opportunity to be here to discuss smokeless tobacco and its health consequences. It is well established that the use of smokeless tobacco causes cancer of the mouth and throat, esophagus, and pancreas. As far back as 1985, the Advisory Committee to the U.S. Surgeon General examined literature on health consequences associated with use of snuff and concluded that the evidence is strong that the use of snuff can cause cancer in humans. The evidence for causality is strongest for cancer of the oral cavity. The excess risk of cancer of the cheek and gums may reach nearly 50-fold in long-term snuff users. Global health authorities have also reached similar conclusion. The World Health Organization's International Agency for Research on Cancer, which I will call IARC, convenes expert panels to evaluate the world's scientific literature on environmental agents to determine whether those agents cause cancer. Those reports are considered to be highly authoritative and are used extensively worldwide to provide the scientific basis for public health action. This group has evaluated the carcinogenicity of smokeless tobacco 3 times over the past 25 years, and I served as a member of the panel of all 3 panels. In 2009, IARC concluded that the use of smokeless tobacco causes cancer of the mouth, throat, esophagus, and pancreas. These findings were based on international data from North America, Scandinavia, and Asia, among other places. Using smokeless tobacco is associated with at least a 4-fold increased risk of oral cancer. Scientists have a fairly clear understanding of how smokeless tobacco causes cancer. It contains carcinogens, the most common of them being the tobacco-specific nitrosamines. Cancer may develop when metabolites of nitrosamines attach to DNA, causing a genetic mutation. This mutation leads to other cellular disruptions and ultimately results in cancer. Nitrosamines are found in all tobacco products and are not safe at any level. In addition to cancer, smokeless tobacco users are more likely than non-users to develop leukoplakias, or white patches in the mouth that can lead to cancer. Other changes in the lining of the mouth related to smokeless tobacco include wrinkling of the inner cheek and gums and color changes. In the 1980s, a national survey of teens found that more than 25% of children who use smokeless tobacco had these changes, compared to less than 1% of children who did not use smokeless tobacco. Cancer and leukoplakia are not the only adverse health effects linked to smokeless tobacco. It's also associated with gum disease, dental caries, and reproductive effects such as decreased fetal growth, increased risk of preterm delivery, and stillbirth. Other serious effects may include increased risk of heart attack and stroke. A recent summary of data regarding this subject showed that smokeless tobacco increased the risk of fatal heart attack by 13% and death from stroke by 40%. Although more research is needed to firmly establish whether smokeless tobacco is a risk factor for heart attack and stroke, these studies suggest that smokeless tobacco may lead to serious health consequences other than cancer. Smokeless tobacco should not be substituted for cigarettes. A large study done by the American Cancer Society examined the health impact of quitting cigarette smoking versus substituting smokeless tobacco for cigarette smoking. It compared more than 110,000 cigarette smokers who quit smoking and did not use any other tobacco products, with 4,400 smokers who switched from smoking cigarettes to using smokeless tobacco. After 20 years of follow-up, the risk of dying was 8% higher among those who switched to smokeless tobacco than among those who quit tobacco use entirely. Those who switched from smoking to smokeless also had a 46% higher risk of dying from lung cancer, a 13% higher risk of coronary heart disease, and a 24% higher risk of death from stroke compared to those who quit tobacco entirely. In another study, using both smokeless tobacco and cigarettes had a higher risk of heart attack than the risks of using either one or the other. It's important that people understand that there is no scientific evidence that using smokeless tobacco can help a person quit smoking. It does not provide a safer alternative to cigarettes. All tobacco products are harmful and cause cancer, and there's no safe level of tobacco use. I want to switch to media findings. Research findings show that when adolescents associate a particular behavior with people or personality characteristics they admire, they're more willing to try that behavior because adolescents identify with such people. Baseball players, like many athletes, serve as role models and are probably considered the quintessential users of smokeless tobacco. There are high rates of smokeless tobacco advertising in magazines such as Sports Illustrated. Considerable research has demonstrated that smoking in movies or on TV increases positive attitudes towards smoking and intentions to smoke and uptake of tobacco use among adolescents. There's also evidence that positive role models can help prevent smoking onset. Several studies show that celebrity health behaviors such as Magic Johnson's announcement of his HIV status or Katie Couric's televised colonoscopy on the Today Show have immediate positive impacts. So actions taken by baseball players to discourage the use of tobacco, smokeless tobacco, could also have positive impact on youth behaviors. We focus today on smokeless tobacco. However, the scientific evidence continues to confirm that tobacco use in any form causes cancer. All tobacco products contain harmful chemicals, and no matter how they are presented in advertisements, be warned that all tobacco products are dangerous. The only way to reduce death and disease caused by tobacco use is to prevent youth from starting to smoke and to help current smokers to quit. These are and must remain our highest priorities, and I appreciate the opportunity to talk to you today.
Thank you, Doctor. We're going to now take questions, 5 minutes, from those who gave opening statements, and we have a few members who passed, so they get 8 minutes for questions. And I'll start with myself. Both of your testimony indicate strongly that smokeless tobacco causes cancer. And we've talked a lot about smoking tobacco and the different chemicals that make up a cigarette that cause cancer. Now, you started to explain how it works with chewing tobacco when there's no smoke inhalation and how that causes cancer. But would just explain it to me again, because it wasn't too clear to me. What is it that causes the cancer? And then you specifically mentioned pancreatic, which, you know, I often mention pancreatic at our hearings because my mom passed away from pancreatic cancer, and you know, most people don't know. You know, when you ask what's the cause of pancreatic cancer, generally speaking, the answer is we don't know. So if you just reiterate some of that.
Sure. I'll start with pancreas cancer first. Important causes of pancreatic cancer are smoking and smokeless tobacco. Heavier weight is also associated with pancreatic cancer risk. But there certainly is a great deal more that we need to learn regarding pancreatic cancer risk, because we know that it is often identified at an advanced stage. With regard to how smokeless tobacco causes cancer, tobacco-specific nitrosamines are a category of carcinogens.
Right.
And tobacco-specific nitrosamines are found only in tobacco products, and tobacco products contain these. They have been found in experimental animals to cause cancer. We also have done experiments that show the progression from the metabolites of these nitrosamines, which attach to DNA. That causes a replication error in the DNA when the DNA.
But in other words, you don't inhale it, so how does it get into your system?
Because you're ingesting.
Just through your stomach, in other words, through your digestive system.
Right.
Okay. And then, you know, we get these muddled messages about, you know, substituting smokeless for, you know, tobacco for just smoking, or, I mean, you've made it quite clear that you think that they're both dangerous. But what about this idea that somehow, you know, you can substitute smokeless, and that you know, somehow weans you off actually using cigarettes?
There certainly are differences in risks between smokeless tobacco and smoking. However, what counts is the potential effect on the population of giving advice to recommend using smokeless tobacco. We have to consider that type of a message may delay or halt some people from quitting smoking who might have quit smoking through some other means. We also know that smokeless tobacco is a gateway to smoking among young children. For example, in one study of adolescent boys, the boys who used smokeless tobacco and no other tobacco product were 3 times more likely 4 years later to be using.
Because there are studies that show that the perception of risk from smokeless tobacco is declining among youth. So bottom line is they may figure, well, I better not smoke a cigarette, but I'll chew instead, and then they get addicted. I mean, that's, we can't give the impression out that somehow that's okay, because what you're saying is it often leads to smoking cigarettes.
Absolutely. And there are no safe levels, and smokeless tobacco causes a variety of diseases.
All right, let me ask Dr. Pahacek, your testimony, you explains how the scientific evidence clearly shows that smokeless tobacco is hazardous, that at least 28 carcinogens have been identified in smokeless tobacco. They cause specific physical feelings and effects, cardiovascular effects, fatal heart attacks. I mean, it seems to me that this is totally contrary to, what a baseball player or any athlete, would want to do. So, how does tobacco use specifically affect the performance of an athlete, in particular a baseball player? And because, young athletes, if they're paying attention, it would seem to me that it would hurt their athletic performance, not enhance it in any way. So what's the message there in terms of what it means if you're young and you start using this stuff?
Well, first of all, our advice to both the Major League, our youthful baseball players, is that like any other person, anyone who's using any form of tobacco, we would encourage them to quit as early in life as possible. And especially important for the baseball players who are studying an example, because like parents, teachers, and coaches, they serve as role models to children and adolescents. With respect to the specific aspects on performance, I can provide you more detail on that from the previous work that has been done in the Surgeon General reports. But the key point is that all users, particularly young adolescents and young adults who are following those role models, need to be aware that all forms of tobacco are addictive and cause cancer and serious health effects, and that quitting all forms of tobacco use as early in life as possible will be very beneficial to their long-term health.
But I mean, I think they almost get the impression, young people, that somehow it enhances athletic performance, and clearly it's the opposite in terms of performance.
Well, the aspects of this and how youth perceive the product have been reviewed in past Surgeon General reports, most in detail in the 1994 Surgeon General report on the impact of tobacco on youth and young people. We're currently updating that report, which will be out next year, and are going into how these current patterns of smokeless tobacco are being perceived by youth and are impacting their overall decisions about what they're doing with using all tobacco products.
Okay, thank you. Gentleman from Illinois.
Thank you, Mr. Chairman. Dr. Pahacek and Dr. Nguyen, I'm getting conflicting briefing things. You're listed as doctors, but in here it says PhDs. Are you doctors, medical doctors that have PhDs, or what's the title here?
PhD, so I'm an epidemiologist.
Okay.
I have a PhD in epidemiology.
Okay, great, thank you. And then I want on Dr. Nguyen. We've had hearings, and I'm new in the ranking member position on the NCI, and we appreciate the great work that the Cancer Institute does, and we really are starting to focus on cost-benefit analysis, where the money goes, biggest return on investment, and and versus the politicizing of some research dollars, and we'll get more involved in that in the future. But what is the Deputy Director of the Division of Cancer Control and Population Sciences? For the layman, what does that mean?
That means that we are the division that is responsible for understanding environmental exposures and genetic factors that may be linked to cancer in human population studies. We're responsible for the cancer registry system. We are responsible for understanding the effects of cancer on people's outcomes in terms of quality of life, physical functioning after cancer. We're responsible for understanding the access to cancer care, quality of cancer care in the United States.
Well, thanks, and I think that helps. But on this hearing, we're focusing on Major League Baseball, but there are other environmental issues that we could probably address. And you know, I don't want to get raked over the coals, but I represent deep Southern Illinois, and of course NASCAR is well known for its advertising, country and Western music. I think most people identify chewing tobacco use with the West and cowboy use and all those. Have you done similar focuses on, or has our committee, or are we just focusing on one area, Major League Baseball, and not looking at other environmental impacts?
Most of the research that I presented was not done in tobacco baseball, in baseball players. Virtually all of the research that I've presented has either been in national surveys of school children or other populations.
Great. Let me follow up with this, and I'm going to go to Dr. Pahacek. In your testimony, you said that any tobacco use, I mean, my colleague, Mr. Boyer, is really on this risk avoidance and mitigation stuff, but your testimony says that patches or nicotine gum is not any help in reducing nicotine and tobacco use for anyone.
No, there are effective ways of quitting use of tobacco. It's quitting smoking.
That's fine. That's really why I want to get a record. In your what you stated, I thought that you'd been, and I think a lot of us would say, no, we want to encourage people to eliminate nicotine input over time, and most people can't do cold turkey. Some can. But I think there are some risk avoidance and mitigation type stuff, and I know my colleague will follow up on that. Dr. Pahacek, on the CDC has, let me just go to, according to December 2009 report from the Campaign for Tobacco Kids, only one state currently funds a tobacco prevention program at the level recommended by the CDC. Do you agree with that assessment?
We are continuing to work with our states, and it depends on which year. Yes, the most recent report put out by the Campaign for Tobacco-Free Kids, by their criteria, found that only one state met our guidelines for recommended funding.
And so our focus probably should be, if we're serious about this, is calling in the states and asking them why aren't they fully funding the tobacco cessation plans as recommended by the CDC. Don't you think that would be another good approach?
CDC is very clear on its recommendations to the states and about what works and what levels of investment would be most effective. We are in regular dialogue with our states about the comprehensive state programs and local tobacco programs that use the evidence-based approaches that have been shown to be effective and to be reducing rates of both youth and adult tobacco use.
Thank you. That goes to my opening statement where I talk about the master settlement agreement, which would be about $206 billion over 25 years that the tobacco companies would pay. Don't you think it's pretty egregious that only 30% of that money has gone to health care and only 3.5% of those funds go to tobacco control, like smoking cessation and education programs?
CDC has been very consistent in providing evidence both to policymakers in individual states and to the other groups.
You're being very political, and I appreciate that. My point is the state attorney generals have a master settlement agreement which should have brought billions of dollars into states. The states have used that money to do other things other than health care and education. You've also testified that you've recommended to the states that they do an educational program, believing that an exponential decrease in tobacco use by kids would occur if they would at least fully fund tobacco cessation and educational programs. I think if you go to the conclusion here, we have states who've received billions of dollars, who've not funded health care, who've not done cessation programs, and now to a point of we see an uptick in at least chew tobacco increase by kids, which is another example of us failing to do the job that we were asked to do and in essence took money for, thus showing how inept we are at doing the jobs we're asked to do by the public. And I yield back my time.
Thank you. Ms. Eshoo.
Thank you. Dr. Nguyen and Dr. Pachik, can you tell us what CDC and the National Cancer Institute have observed with regard to use of smokeless tobacco by teenagers?
In my testimony, I reviewed the latest evidence that the multiple surveys have shown an increase in smokeless tobacco use overall in youth populations. The data that we are going to be releasing this summer is the National Objective Youth Risk Tobacco Survey is showing an increase in smokeless tobacco use among adolescent males, high school males overall, and white students.
And in the minority community?
The NISDA survey, the National Household Survey on Drug Use and Health, has found that when it's looking at the recent increases nationwide in smokeless tobacco use over the last 4 to 5 years, that the greatest increases have been in non-Hispanic, white, and Hispanic males. So while there have been traditionally higher rates of use in some other demographic groups, non-Hispanic white males and Hispanic males are the ones who appear to be showing the greatest increases in recent years.
Do you have any thoughts on what accounts for these increases in smokeless tobacco use? I mean, obviously we have representatives from baseball here today. I think that everything that adults do, from being a parent to obviously anyone in sports, is a you know, they're the gladiators of the 20th and the 21st century, so they heavily influence young people. I think we do as well. Congress isn't always known for putting forward all of its best, but certainly when there's something that goes wrong here, by example of an individual member, that says something to the people of our country and obviously young people. So do you have anything that you want to tell us about what you think accounts for these increases in smokeless tobacco use?
Yes, other comments that are in my written testimony, which we submitted, is that these recent upticks need to be placed in the changing context of tobacco use in this country. Smoking rates are down, and restrictions on smoking in public places are increasing, particularly in your state of California. And overall, we've observed that there's a decreasing social acceptability of smoking. However, there's also, while these things are occurring, significant changes in the smokeless tobacco industry and how smokeless tobacco products are marketed. Until 2006, smokeless tobacco was largely produced by companies that did not manufacture cigarettes. Now, major cigarette manufacturing companies produce and sell most smokeless tobacco products in the U.S. In recent years, these companies have been marketing smokeless tobacco and snus named after their leading cigarette brands. The advertising and promotional spending on these types of moist snuff products increased by 50% between 2005 and 2006, the latest year in which these data are been reported. This timing is significant because it was at this point in time that this transfer from the smokeless tobacco manufacturers being independent of cigarette makers started. A particular concern is that many of these new smokeless products are being marketed in a way for smokers to satisfy and sustain their nicotine addiction when they are in settings that they cannot smoke. Additionally, to your point, while We do not have any new and more detailed studies with respect to sources of influence. The two largest groups where we're seeing the increase are in non-Hispanic young men and in Hispanic men. And additionally, we know from other data that the
well, let me just ask you about that. It's a little confusing. Non-Hispanic young men and Hispanic older men?
No. 18 to 25-year-old white and Hispanic. We call it non-Hispanic white to separate it from Hispanic that self-identify as Hispanic. So both Hispanic and non-Hispanic young men who are,
you know what?
who are most likely to be athletes.
It sounds, I don't understand what you're saying. Let me put it that way. All right? Just,
so, young
just name
men,
the groups. Name them.
White and Hispanic young men, 18 to 25 years old, are increasing more than anybody else.
Okay. All right. Well, I think that these are really disturbing trends. I just leaned over and I said to my staffer a little while ago, why not, when it comes to baseball players, why don't they just chew gum? I mean, if they feel like they need to chew something, and she responded, because they're addicted. So clearly, I think there's a nexus here. I don't think it has everything to do with those that play baseball, but on the other hand, they are individuals that are really looked up to. And young people always want to, look in the mirror and see the reflection of their heroes. So I think that we need to work hard to find a way to reverse these trends and make sure that smokeless tobacco really, that when you come back in succeeding years, that we can claim that there is a huge decline. This isn't something that's healthy. So anyway, thank you very, very much for your testimony. Dr. Nguyen, I think, well, I'm over my time, so I don't know if you wanted to add something to it, but maybe you can when someone else questions you. Thank you very much. Thank you, Mr. Chairman.
Thank you. Gentleman from Kentucky, Mr. Whitfield.
Thank you all for being with us today. I think that Congress has given the regulators a lot of opportunities to make great progress in this area. It is true, Mr. Paycheck, isn't it, that on June 22nd, 2010, it will be illegal to sell a smokeless tobacco product to anyone under the age of 18. Is that correct?
Yes, that's my interpretation, my understanding of the bill. Yes, correct.
Okay. Now, many of us were not aware of it, but in the stimulus bill, which certainly was about creating jobs, there was $650 million set aside in there to address clinical and community-based prevention and wellness strategies. And it's my understanding that that money was given to HHS and CDC to get this money out there. So my question would be, number one, of that money, how much went for tobacco strategies in the states or the local communities?
I don't have those detailed numbers, so we would be happy to provide those to you and your staff in this committee. Yes, but tobacco prevention.
Did you all, in your regulations, when this money became available, did you, in your regulations, set out how much money should be spent on nutrition, how much money on tobacco, how much money on obesity, or anything like that?
Well, yes, so we can provide you the details on the funding announcement. The priorities were smoking prevention and obesity.
You set a certain amount of money for each one of those in your regulations?
There were funding guidelines that were put out to the states, and the actual numbers we can get you in terms of how the breakout on that.
Now, how much money remains to be spent of that $650 million?
The application awards, I believe, are completed now and are available, that we can make available to you. I think all has been has gone through funding announcements and award.
Well, how much money has already been sent out?
I'd have to get our administrative people to give you the details on that, since the applications have been reviewed. However, the process of actually getting the money into state budgets, is an administrative
So you don't know how much money is going to be going out in grants, and you don't know how much money has already been distributed to states and local government under this program.
With respect to that $650 million, all of that money was put into funding announcements. So, yes, all of that is going out. But
we know one of the things that, this is a big problem, obviously, smokeless tobacco and its impact on health. But to put this money in a stimulus bill, and then I read an article that in Washington, D.C., they received $977,000. They created one full-time job. And what did they do with that money? They bought BlackBerries for people so that they could be in touch with their smoking counselors. Now, do you consider that a good utilization of the money?
I don't have any details on that specific case. However, there's very specific guidance that is provided in the funding announcement from CDC with regarding to the most efficacious comprehensive strategies that have been shown to be effective and cost-effective in reducing tobacco use.
Although we were not aware of it in the health bill itself that passed, in the first 5 years, there's over $5 billion set aside for a grant program to go out addressing the so-called MAPS Intervention for Communities program. Where are you all in developing the regulations for that?
Well, for a point of clarification, CDC is not a regulatory agency, a public health agency. With respect to
HHS, where, do you know where they are on it?
The specific aspects of that overall program.
Will you be involved in distributing that grant money? Will CDC be involved?
CDC has a role in in working with HHS and the White House with respect to guiding the evidence-based interventions that have been found to be most effective.
Yeah. Well, I know in your position you're involved with smoking and health. I want to ask one other question. One of the guidelines that they put in the area of nutrition and spending this money is urging communities, local communities, to reduce density of fast food establishments. How do you propose that be done? What do you hope? How do you hope that will be accomplished?
That is a content area that is outside of my division. With respect to issues on tobacco, I can give you more specifics, but we can provide you feedback on what we're doing on density of fast food restaurants, if you would like.
Thank you. I see my time has expired. Mr. Chairman, if there is not an objection, I would just like to insert for the record a publication of the National Convenience Store Association going into some detail about the health portion of the stimulus bill, as well as the Washington Times article about the BlackBerries.
If I could see them, but I'm sure there's no problem. It says one is the Washington Times and the other is, what was the second one?
If you want the entire...
Oh, it's from NACS Magazine. Yeah. Without objection, so ordered.
It's the April 2010 issue.
Without objection, so ordered. Mr. Engel.
Thank you, Mr. Chairman. Dr. Wynn, your testimony describes baseball players, and I'm quoting you, as the prototypical user of chewing tobacco, unquote. You also note that, and again, I quote from your written testimony, that, quote, adolescents engage in more risky behaviors, including tobacco use, to the extent they endorse positive prototypes of individuals who engage in those behaviors, unquote. I know that Mr. Manfred from Major League Baseball and Mr. Prouty from the Major League Baseball Players Union are in the audience for this testimony, and we'll hear from them later, but I want them to hear your views on this matter. So let me ask you this. Very simple question. When teenagers and young adults see Major League Baseball players using smokeless tobacco, does it make more likely that these young people will themselves become users?
That is likely based on evidence that shows that peers and parents and other role models for children influence their use of smokeless tobacco.
So it was an obvious question. I knew that would be your answer, so let me also ask you another obvious question. Do you believe that if Major League Baseball and the Players Union were to agree to ban the use of smokeless tobacco on the field and in the dugout, would that result in a reduction in smokeless tobacco use among teenagers?
Well, certainly the evidence from Katie Couric's colonoscopy and Magic Johnson's HIV status definitely had an impact on a positive impact on the U.S. public in terms of taking preventive measures. So it seems likely, by analogy, that that would have a positive effect on youth in the U.S.
Thank you. Dr. Pekacek, do you have any thoughts of the impact of the use of chewing tobacco by Major League Baseball players?
The evidence that we have reviewed in the 1994 Surgeon General Report, as well as other documents since then, shows that professional athletes in certain sports, including baseball, have traditionally have had high levels of smokeless tobacco use. Athletes serve as role models for youth, and smokeless tobacco manufacturers have used these imageries in advertising testimonials by featuring athletes in sports to make smokeless tobacco products appear attractive to youth. Teens tend to mimic the behaviors of those who they look up to and identify with, including baseball players and athletes. While smokeless tobacco use was prohibited in minor leagues in early 1990, this policy has not been extended to major leagues.
Well, thank you. Dr. Wynn, I've heard reports that in Sweden, significant numbers of people are quitting smoking and using smokeless tobacco, and that the country's rates of lung cancer have gone down. This might seem to support the argument that smokeless tobacco is a form of harm reduction. This argument rests on the idea that the use of smokeless tobacco is good because the risks of death and disease from using smokeless tobacco are less severe than the risks of death and disease from using cigarettes. So I want to ask you about that. Does that idea match up with reality? Is smokeless tobacco really a form of harm reduction, especially when we're talking about children who are not yet using any form of tobacco? I think that this notion of harm reduction becomes even more untenable in the case of young athletes. In general, my understanding is that young athletes are less likely than the general population to smoke cigarettes, but they're more likely to use smokeless tobacco. I want to hear your thoughts on that.
Well, I've reviewed the report, those Swedish statistics, and want to note that the claim that because the rates of smokeless tobacco have gone up, that has influenced the rates of smoking going down. Well, I want to emphasize three fundamental facts. One is that all tobacco products are hazardous and there's no safe level, and what we need to do is prevent its use and help them quit. But with regard to the Swedish situation, even the Swedish National Institute of Public Health found in their survey that of Swedish women who use snuff, that's a relatively small proportion of women in Sweden use snuff, but smoking rates have dramatically declined in Swedish women, indicating that snuff is actually not responsible for the decline in smoking. There is a continuum of risk associated with both smokeless tobacco and smoking, but we are most concerned about issues related to dual use of smoking and smokeless tobacco, and on smokeless tobacco as a gateway for children.
So in the case of young athletes who don't smoke cigarettes but use smokeless tobacco because they see Major League Baseball players using it, would it be fair to say that smokeless tobacco use significantly increases their health risks?
Yes. It increases their risk of oral lesions in their mouth, and many oral lesions have the potential to develop cancer, oral cancer.
Thank you. Thank you, Mr. Chairman.
Thank you. Gentleman from Indiana, Mr. Boyer.
Thank you.
Dr. Wynn, with your I'm trying to reconcile a couple of comments. You acknowledge that there is a continuum of risk within tobacco products, smoking to smoke less, pharmaceutical, and quitting. A continuum of risk. You acknowledge that, correct?
There's a continuum of risk associated with
from very high risk to very low risk. You acknowledge that?
quantitating it at the high or low, they all have risks.
You acknowledge that there is a continuum of risk from very high risk to very minimal risk. Do you acknowledge?
Very high risk to moderate risk.
To moderate risk. So if I can say that in proven science that there is a product on the market that would remove 99% of the nitrosamines, you would define the 1% as moderate?
All smokeless tobaccos have some risk of health effects.
That's correct. I concur with that. Now let me go back and acknowledge this. Let's not play games. Do you acknowledge that there's a continuum of risk from very high risk to very low risk?
Of specific
to the health effects and the use of tobacco products?
Some tobacco, for example, chronic obstructive pulmonary disease is not caused by smokeless tobacco.
I'm not going to quibble with you, because it appears that if you only not even acknowledge that there's a continuum of risk, then you're placing yourself in a camp of complete abstinence. Now, I will concur with you that tobacco products are not healthy. I concur with that. But to ignore that there is a continuum of risk from very high risk, cigars, to very low risk, which would be a product that would, let me ask it this way. If you're able to put a product on the market that reduces the nitrosamines, does that improve the chances of one's, or does that eliminate then health risks?
What causes us concern under those circumstances is the population effect that might be influenced by people smoking and adopting a smokeless tobacco.
Do you acknowledge that if I can reduce the nitrosamines in a product, that I can reduce the risk?
There's no epidemiologic evidence that shows that that is the case. It's certainly, it is important that that nitrosamine levels be reduced.
So are you saying to me then that an orb or a stick that has reduced 99% of the nitrosamines is just as harmful as smoking a cigar? That's what your statement is saying.
Yes.
And you concur with that?
Assessing nitrosamine levels or reduced nitrosamine products is under the purview of FDA, so I would refer.
All right, great. Your staff just gave you that so you could read it. But just answer the specific question.
We don't know that there is any. There is no level of nitrosamines that is known to be safe.
Wow. So you are unwilling to recognize differentials of risk within tobacco products. That's what I guess that's what I'm hearing from you. You do not acknowledge that there's a differential of risks among tobacco products?
There is a continuum of risk.
Oh, thank you. Thank you. We got there, didn't we? We got there. There's a continuum of risk. Now, why is that important? It's important because as a country, those of whom are the advocates of an abstinence approach are locking us into a system of failure. If we only have up to 7 or 8% of whom want to quit, that's failure in my eyes. And so if we can actually migrate a population from smoking to smokeless to eventually quitting, that's important. Now, no one wants our teens or adolescents or youth or you name it to gain access to these products. So I concur with you on that point. Mr. Chairman, I respect you because you are open to many different distillations of thought. And I believe in personal cultivation. I believe in the scholarship maintenance of our knowledge. It improves our self-worth. And as our quest for a greater understanding and ration and reason and wise tolerance to ameliorate, I'm going to offer some differing views. And I'd like to offer them for the record. So what I would like to offer for the unanimous consent to be placed into the record, first is a report called A Broken Promise to Our Children It's an 11-year analysis of the fact how the states are not spending the MSA settlement on tobacco prevention. I ask unanimous consent this be placed into the record.
Can I just ask, are some of these things going to be part of the printed record, or can we just do them, how does it work? And it looks like it's pretty extensive. We can? Okay. Without objection, so ordered.
I'd also ask unanimous consent that the Strategic Dialogue on Tobacco Harm Reduction, a Vision and Blueprint for Action in the United States by Mitch Zeller and Dorothy Hatsukami also be entered into the record.
Can I look at that when we... Go ahead. Why don't you continue there while we're...
I'd also ask unanimous consent that the smoke-free tobacco and nicotine products reducing the risk of tobacco-related diseases by Scott Valen be entered into the record.
Let me just take a look as you continue.
And last, I would ask unanimous consent, no, not last. I'd ask unanimous consent that the brief report on evidence against a gateway from smokeless tobacco use to smoking by Dr. Brad Radu also be entered into the record.
Pretty extensive, guys. I'm just taking a minute here because I noticed they're pretty extensive, and I just want to make sure we're going to be able to... We can do it. Okay. Okay. Is that everything?
Yes.
All right. Without objection, so ordered.
All right. Thank you.
Okay. Next is our Vice Chair, Ms. Capps.
Thank you, Mr. Chairman. I want to thank our witnesses for their excellent testimony. I particularly want to thank the second panel for your patience in weighing through this first one, which is our process here in the subcommittee. I have a question for each of you, and I'm going to start with Dr. Pahacek. I was particularly alarmed by your statement during your testimony that the perceived risk of harm from smokeless tobacco has decreased, actually decreased among teenagers. You know, we've taken such, I think, quite significant steps through enactment of recent health reform legislation to invest in greater wellness and prevention strategies as a whole. We have this opportunity with some of these new parts of the reform legislation. I would like you to give us some advice of what strategies we could take in our local communities through our health clinics expansion and so forth to reverse this very alarming trend.
Comprehensive state and local tobacco control programs that we have defined in our multiple CDC documents give evidence-based approaches that have been shown to be effective in reducing tobacco use overall as well as smokeless tobacco. These approaches change environmental cues in ways that make tobacco use in any form less acceptable and quitting easier. These types of programs include educational strategies as well as public policy changes that send a clear message to youth that smokeless tobacco, along with all product use, are dangerous to their health. On a concrete level, CDC has been communicating a clear message that there is no safe form of tobacco use and that any tobacco product is hazardous to health. For example, the CDC has recommended since the mid-1990s that schools implement 100% tobacco-free policies that eliminate all tobacco products by faculty, staff, and students, including smokeless tobacco on school grounds, at school events, including sporting events. CDC closely is monitoring trends in the smokeless tobacco use and how different marketing campaigns are impacting youth and providing this information to our states so they can more effectively provide informational campaigns that can turn around this negative trend. Yes, we are concerned about this downturn in perceived risk, which is in 8th, 10th, and 12th graders, with the largest drop in 10th graders. This indicator has been a very reliable leading indicator of this type of question, not only for smokeless, but for cigarettes, alcohol, marijuana, and other behaviors. Therefore, this downturn does indicate reason for concern.
Thank you. And I have a feeling our second panel is going to elaborate on some of the specific ways that we can really get this message across. That's such a key age group, and their habits, of course, will will impact their health for a lifetime. I appreciate that from the CDC. Now, a question for you, Dr. Nguyen. During our committee's debate on giving the FDA authority to regulate tobacco products, some of our colleagues were advocating policies promoting the so-called lower risk of tobacco products. I think you heard some of that voiced today as well. In your testimony, you clearly outlined that transitioning from cigarettes to smokeless tobacco actually contributes more to more negative health outcomes in many cases. And just for the record, I would like to have you elaborate a bit more on this strategy, because this is a myth that keeps rearing its head. And doesn't it make more sense to provide comprehensive education about all tobacco, kind of in line with what Dr. Pachik was saying, to include information about why it is all dangerous and how to be empowered to resist and reject it?
Right. We certainly, the evidence to date, and it's a growing literature, indicates that using both behaviors increases risk of several chronic diseases. And that's a great concern that we have with regard to some of the trends in youth using both products together. This is a very concerning trend that we have. Is there an additional specific question?
No, well, I think you're highlighting the goals for having comprehensive education. In other words, if you're talking about stopping smoking cigarettes or never starting with young people, you want to also make sure that they don't see an alternative, that it all has to be presented at one time, and otherwise they're going to fall prey, because the targeting of advertising, and we've seen this with cigarettes as well, is so insidious with young people. The targeting of just the right images, using athletes, which is understandable. They're heroes. My grandkids look up to them. If they even see them without even saying a word, chewing, they're going to, that'll be in their subconscious to be tempted to try. So I appreciate that very much. Thank you. I yield back.
Thank you. The gentlewoman from Tennessee, Ms. Blackburn.
Thank you, Mr. Chairman. I appreciate that. And I've got just a couple of questions that I want to direct to the two of you together. And again, thank you for your patience for this morning. The CDC's Youth Risk Behavior Survey measures smokeless tobacco among high school students. That's correct, right?
Yes, 9th through 12th graders.
Okay, and it also publishes data for individual states and a number of major cities. And as we were getting ready for the hearing, I looked at the data that was there for several Major League Baseball cities, including Baltimore, Boston, Chicago, Detroit, Houston, LA, Miami, Milwaukee, New York, Philadelphia, San Diego, San Francisco, and Washington, D.C. I wish that Nashville or Memphis was included in that list, but it's not. But we'll talk about that another day. So, given the topic of this hearing and what we were going to be discussing, and looking at your survey, I found something very interesting. Every single one of those major league cities, every one of them, every single one of them, believe it or not, had a teenage smokeless tobacco rate that was below the national average. And I found that so interesting. The major league cities have a smokeless tobacco rate that is below the national average. And the same is true when you go back and you look at the previous CDC surveys, which are published every 2 years. It was true in 07, it was true in 05, it was true in 03, it was true in 01. You know what? There is not one single exception. Not one. Every single Major League Baseball city in every single year where the CDC survey measured, it was lower than the national average. So, if baseball players are having such a dramatic impact on teenage smokeless tobacco use, why would evidence of this impact only occur in places where there is no Major League Baseball team? I want to know if there was any finding in your work that would shed some light on that, and I'd love to hear from both of you on that.
Thank you for your question. Yes, there is evidence that will help explain that.
Wonderful.
First of all,
elaborate.
First of all, rates of smokeless tobacco use traditionally have been higher in more rural and other parts of the country. We can provide you more detail on the geographic breakdown. Additionally, the rates of smokeless tobacco use among African American populations is much lower than overall in other demographic groups. So those two facts alone would, by just the demographics of the major cities that you mentioned, result in a differential. When we are looking at the influence of any factor, what we are looking at is the exposure. One of the main things that we have to be aware of in the exposure is that the primary exposure is not necessarily attending the baseball games, but watching them on the media. And so that the geographic distribution of the imagery exposure is quite different than the location of the stadium. Now, we do not have any published studies with respect to number of minutes watching Major League Baseball and its impact, but the data that has been done will show that it's the youth that are paying attention to baseball that may be at the greatest risk.
Okay, so let me ask you this. Looking also at your surveys, you see that the use went down from 11.5 in 93 to 7.9 in 07, and from 20.4 among teenage boys, the smokeless tobacco rate has dropped from 20.4 in 93 to 13.4 in 07. So, what factors have been working so well in recent years? What is it that is being done in recent years that is causing young people to choose not to use smokeless tobacco? Is it education? Is it parents? What is it outreach? Was it the tobacco settlement agreement? What do you think has helped to spur that kind of drop in usage?
First of all, the types of programs that work for smokeless tobacco are very similar to those that work for preventing all tobacco use, cigarettes and other forms. What we have found is that the comprehensive types of programs that focus on public policy change along, such as smoke-free environments and other types of things that are sending a clear message that all tobacco use is harmful, is reaching youth. The programs in the mass media are particularly effective that are providing broad messages about the risk of tobacco use, such as the legacy media types of campaign, as well as the state-specific campaigns. All of those types of things are effective in preventing cigarette use and smokeless tobacco use. One of the things that is of concern is that while we have been seeing a decline in both cigarettes and smokeless tobacco use through about 2005, the data that will be published this summer from the Youth Risk Behavior Survey shows a reversal of those trends that you were citing, and that when you look at all the data points, including the 2009 data point that will be released this summer, that the rates of smokeless tobacco use among high school males has reversed and is now increasing, with the point of deflection or the statistical point of change being 2003. So for a number of years now, the pattern in multiple surveys is showing an increase of smokeless tobacco use among youth in general, particularly males, particularly white and Hispanic males.
Thank you very much. I'm over my time. I'll yield back. Thank you, Mr. Chairman.
Thank you. Gentleman from Maryland, Mr. Sarbanes.
Thank you, Mr. Chairman. I have a couple of sort of random questions here. Just following up on the surveys, the cities that my colleague mentioned where the rate of smokeless tobacco use is lower than the national average, is it, however, the case that if you looked at the use among the two populations you cited, being Hispanic youth and non-Hispanic white youth, that in those cities you would find evidence of this trend of an increase, even if it wasn't carrying the statistic above the national average?
The individual data will be released this summer with respect to all of the locations, including the national data. What we're seeing in the overall pattern is, yes, across the nation in non-Hispanic, white, and Hispanic youth, we're seeing the uptick. This uptick has been going on for several years now. With respect to patterns in specific communities, we have not had those levels of analyses yet, but we certainly are willing to look into that.
So it's at least possible that even though the increase hasn't taken the statistic above the national average in some of those places cited, that the fact that there's an increase could be connected to the use by role models such as Major League Baseball players. A lot of the discussion is focusing on Major League Baseball, responsibility to implement restrictions on the use of smokeless tobacco because of the role model status that the players have. This isn't really a question, it's just kind of an observation. And I guess the second panel is in a position to speak to this better. I would just think that the owners and team management and the league itself would be interested, given the kind of investments they make in their players, financially and otherwise, to put these kinds of limitations in, regardless of the impact it's having on youth or other members of the public, given the litany of effects that you've been able to describe today in terms of how harmful it can be and how quickly the conditions that it causes can develop. That's the other thing that's striking when you look at the testimony that you've presented. So I just want to introduce that theme here, that it's not simply about the example that's being set that ought to cause us to call upon Major League Baseball. I would just imagine that as a matter of good practice and good business management on the part of the league and the owners, that they would have wanted to institute this. It's been done at the minor league level, so somebody's figured out that it's not a great thing, because it's not the role model aspect of the minor league baseball players that led to that ban being put in place. It must have been some other consideration, like the health of the players. So I just don't understand why that wouldn't apply to the major league players. Let me ask you, is the restriction on advertising on television and so forth that applies to smoking tobacco, does that apply as well to smokeless tobacco?
The new FDA legislation signed last year extends the restrictions to more completely to smokeless tobacco. Okay.
So when you think about, I was reading some of the testimony in one World Series game. Somebody calculated there was 9 minutes of tobacco use that would have been viewed by someone who watched the whole game on the part of the players. That's like a giant loophole, isn't it, in terms of being able to distribute this kind of imagery over the airwaves? Is it fair to characterize it that way?
I believe our next panel is going to go into that in more detail, but in general, as we've reviewed in recent Surgeon General reports from 1994 on, those types of imageries do reach youth and do have an impact.
Right. And more sinister, arguably, because it's more kind of just woven into the fabric of what they're seeing than a full-force advertisement might be. Thank you, and I yield back my time.
Thank you, Mr. Sarbanes, and I guess that concludes our questions for the first panel, but we do want to thank you, and you may get questions from us, written questions, within the next 10 days that we'll ask you to get back to us as soon as you can, so thank you very much.
Thank you.
And if I could ask the second panel to come forward, and you see where your name tags are there. You take your seats, and we'll proceed. All right, let me introduce each of you. First, on my left is Grun von Behrens, who is from Stewardson, Illinois. Thank you for being here. And then we have Robert D. Manfred, Jr., who is Executive Vice President of Labor Relations and Human Resources for Major League Baseball. And then we have David Prouty, who is Chief Labor Counsel for Major League Baseball Players Association. And then the famous, it says here Joseph Henry, but Joe Garagiola Sr., who's a Major League Baseball announcer and a former Major League Baseball player. And then finally is Gregory Connolly, who is a professor of the practice of public health at Harvard University. And I, again, thank all of you for being here today. Try to keep the comments to 5 minutes. Your statement becomes part of the record. And, of course, after you can submit additional written statements or comments, if you will, after you leave here today. So I'll start with Mr. von Behrens. I hope I'm pronouncing it correctly.
That is correct, and thank you for my ability to be here today. I appreciate the opportunity, and I really hope that this message I bring to you will make you all a lot smarter about what tobacco can do to you. My name is Grun von Behrens. I'm the national spokesperson here today on behalf of the World Health of America and NSTEP, and also myself. I travel throughout the United States as a motivational speaker to youth about the dangers of tobacco use. I have currently been in 46 of the 50 states of America, every province of Canada, and have spoke to over 2 million kids across North America about this topic. I work with different collegiate and minor league athletic programs. I work with different news and media across the United States. A lot of very important people take what I have to say to heart when it comes to this topic. Now, first things are first. I always apologize to my viewers because I understand that can be kind of hard to understand. I've had 34 surgeries to my mouth and to my neck. Doctors have had to cut off half of my tongue and do 34 different surgeries to my mouth and my neck to get rid of the cancer I had. And not everything that I say always comes out the way I want it to, so I apologize to the panel. Now, nobody tells me that I have to do this. All right? I didn't get in trouble in our home state of Illinois. And they're like, all right, girl, as your punishment, you have to go out in public, show people your face, and tell them that tobacco did that to you. That's not the reason I do this. I don't do this as an authority figure, as somebody who's going to preach to anybody for using a tobacco product, because me as an ex-tobacco user realizes how powerful of an addiction this product can enlist on its victim. So I'm not out there knocking cigarettes out of people's hands. I'm not knocking 2 cans out of their back pockets. I want people to have a fair choice with their life. I want my viewers to be able to look at my face and through my words and my story understand what I've been through so they can make an educated and thoughtful choice for themselves about whether or not they want to take up this addiction or not. I come from a very small town in the Midwest. 750 people in my hometown. That's counting farm animals and small dogs, so it's a very rural area. And as a part of the culture of that area, we use tobacco. My grandfather used tobacco. My uncle used tobacco. Why would these 2 men who love me dearly and helped bring me up offer me a product that could hurt me this bad? So I was very naive that this could happen to me. And I hope that by traveling around the country and educating youth about the dangers of tobacco, not only youth, but parents, certain forms of government, all different forms. You know, we're sitting here with Major League Baseball, and I think it's great that we've targeted baseball. I think that as a baseball player growing up, I idolized a lot of the people I was watching on TV, and that led a small part to my tobacco use, but not to the main reason why I use tobacco. Guys, across the United States, there is a culture out there where people pick up these habits at a very young age because of this being naive to what this problem or this product can do to you. The amounts of kids and the people that I see victimized by this drug is phenomenal. You know, I see 8-year-old kids using spit tobacco. I see mothers wiping their babies' gums with spit tobacco wrapped in nylon stocking to cure a toothache. You know, I see 10, 11, and 12-year-old kids coming up to me after my presentation and hand me their true can and saying, I don't want to use this no more, because I didn't know that could do that to me. As I said, I really appreciate the opportunity to be here today. I hope that this message brought to America can educate them about the dangers of tobacco. You know, I see our government sometimes almost telling us that spit tobacco is a safer alternative to cigarettes. You know, in numerous states they raise the taxation on cigarette sales, but they will not raise the taxation on tobacco sales. So as a whole, is that them telling us to ourselves that this is a safer alternative when I know it's not? Every dip of spit tobacco that somebody puts into their lip, into their oral cavity, has the same cancer-causing ingredients in it as 3 to 5 cigarette smoke. So they're hurting their oral cavities just as bad as whether they would be if they ingested a cigarette. And then we talk about harm reduction. Harm reduction. I laugh at the face of harm reduction, guys. You get lung cancer, you get oral cancer. What's the difference? You still got cancer. You still have a very deadly disease that you have to fight for your life to fix. Guys, I started using tobacco at the age of 13. At 17, I was diagnosed with a full-blown oral cancer. And so often people come up to me and say, oh, really, oral cancer or spit tobacco only hurts the person using it. I wish each and every one of you in here who are interested, seriously interested in this cause, could be with me the day that my mom found out I was sick. The day my mom sat in that doctor's office with me and bawled her eyes out because her son had been diagnosed with this disease because of his trickery and a misconception that this thing was a safe thing to do. And the impact that had on my mother, man, I had people come up and say to me that it only affects the person using it. That's not right. It affects everybody in the community. It affects each and every one of us. People are getting sick from this as a government. Do what it takes to fix this problem. I don't care if it's with baseball. I don't care if it's with health care. Governor Barton says this isn't a very important thing. We ought to worry about health care. I think we are worrying about health care, guys. We're starting on this level. All right? Let's make it this level. Thank you for your time. I appreciate the opportunity to be here.
Thank you. And let me thank you also. I didn't realize how often you go around and how many states and how much you've become a spokesman for this. And we really appreciate that. Thank you.
Thank you.
Mr. Manfred?
Chairman Pallone and members of the committee, thank you for the opportunity to be here to address our shared commitment to the reduction of the use of smokeless tobacco products. I'd like to briefly review Major League Baseball's past and ongoing efforts to reduce or eliminate the use of such products by players, as well as the legal framework within which Major League Baseball's efforts have been undertaken. For almost 2 decades, Major League Baseball has worked on multiple fronts to reduce the use of smokeless tobacco products and educate members of the baseball community accordingly. The centerpiece of our effort is the minor league tobacco policy, which was issued by Commissioner Seelig in 1993. That policy bans the use and possession of all tobacco products by club personnel, including players, in minor league ballparks and during team travel. We believe that our efforts at the minor league level are crucial because players must learn at an early age to avoid these products. The minor league policy, is displayed in all minor league clubhouses, and each minor league player contract requires the player to represent that he's aware of the policy and agrees to its provisions. To ensure compliance with the policy, Major League Baseball's resident security agents conduct roughly 100 random security inspections of minor league ballparks annually. Players and field managers who violate the policy are subject to game ejection and incur substantial monetary penalties. Major League Baseball has also administered a formal policy regarding tobacco products at the Major League level for well over a decade. Pursuant to the Major League policy, clubs may not permit the distribution of tobacco products in Major League clubhouses. The Major League policy likewise encourages clubs not to permit club personnel, clubhouse attendants, and the like to buy tobacco products on behalf of players. I should also point out that club personnel are barred from smoking when in uniform in view of spectators, and contrary to a suggestion that was made in the earlier panel, our athletes are not allowed to participate in tobacco advertising while in uniform, and I am not aware of a single Major League player who endorses tobacco products publicly. Our efforts to reduce the use of tobacco products extend beyond formal disciplinary measures and into education and treatment. To that end, the minor league policy encourages field managers to hold tobacco education meetings with their clubs and waives fines for first-time offenders who complete cessation counseling programs that are provided by the club's employee assistance professionals. Major League Baseball has also collaborated extensively with its partners to raise public awareness. In 1994, Major League Baseball helped establish the National Spit Tobacco Education Program to curb the use of smokeless tobacco products. Major League Baseball has provided NSTEP and its partners with over $100 million in cash contributions, television exposures, and other support to conduct public service activities and announcements which featured players, including stars like Hank Aaron and Derek Jeter. Within the baseball community, NSTEP has served major and minor league players via numerous education and treatment options. These options include oral examinations, brush biopsies, educational seminars, cessation programs, and training for club employee assistance professionals. Through 2003, Major League Baseball, at times in conjunction with the Major League Baseball Players Association, sponsored NSTEP programs with the assistance of grants from not-for-profit organizations, including the Robert Wood Johnson Foundation. Clubs continue to administer oral examinations and smokeless tobacco education programs as part of their annual spring training activities. Highmark Blue Cross Blue Shield, the insurance provider for minor league players, also conducts an annual spring training presentation for players that addresses tobacco cessation options. Largely because of these efforts, the use of smokeless tobacco products has declined substantially in baseball over the last 2 decades. Commissioner Seelig, nevertheless, remains committed to exploring additional opportunities in conjunction with the Safety and Health Advisory Committee, a joint committee of baseball and the MLBPA. Last November, at Commissioner Seelig's urging, the committee hosted a presentation on smokeless tobacco prevention by Dr. Ashok Shah, a head and neck surgery specialist from Memorial Sloan Kettering Cancer Center. During the 2010 season, the Commissioner's office will be surveying players to develop other educational and treatment programs. As we carry these initiatives forward, however, it is important for the committee to bear in mind the legal framework that applies to smokeless tobacco. Like drug testing, the regulation of player use of tobacco products is a mandatory subject of collective bargaining. But unlike performance-enhancing substances, smokeless tobacco products are legal in all 50 states and for sale to and consumption by adults. And even the most ardent critics of smokeless tobacco use as a public health matter would not argue that it compromises the competitive integrity of our game in a manner analogous to performance-enhancing substances. While an outright ban on the use of smokeless tobacco in the major leagues is a laudable goal, it will have to be pursued against the backdrop of these legal realities. I thank you for your time.
Thank you, Mr. Manfred. Mr. Prouty?
Thank you, Chairman Pallone, members of the committee, thank you for
Yeah, either bring it closer or
Yes.
turn it on.
Got it.
That's good.
Thank you for the opportunity to testify today. My name is David Prouty. I'm the Chief Labor Counsel for the Major League Baseball Players Association. I won't repeat verbatim my written testimony, but I just want to make a few points based on that testimony and also what we've heard today. First, no one disputes the health risks of smokeless tobacco. You've heard the medical evidence today, you'll hear more, and you've heard the compelling testimony of Mr. Von Behrens. The Players Association completely agrees that smokeless tobacco poses a huge health problem for this country. Second, and it's for that reason that the Players Association has long discouraged its members from using smokeless tobacco. We've participated in educational programs to alert the players and the public to its dangers. For players, we've run educational seminars and offered medical screenings and spring training. We've participated in the NSTEP program that Mr. Manfred referred to offer cessation workshops. We've worked with Mr. Garagiola, in fact, brought him to address a meeting of our executive board to talk about this topic. For the public, we've worked again through NSTEP on various outreach programs, including the taping of a series of public service announcements involving prominent players, including Derek Jeter, Hank Aaron, and also Jeff Bagwell and Alex Rodriguez. We've also embarked on a new program with a Partnership for a Drug-Free America called Healthy Competition, which is focused on helping parents and children to make smart decisions regarding health and nutrition. The players want to help kids choose what to do, not just tell them what not to do. Through this program, we hope to educate young people, both athletes and non-athletes, to make smart choices when it comes to fitness, supplements, drugs, alcohol, and tobacco, including smokeless tobacco. Third, the obvious question: why isn't smokeless tobacco banned in baseball? Remember that smokeless tobacco is a legal product available for all adults to purchase everywhere in the United States. While we can and we will educate players as to why they should not use it, there's a tension here because many players do not think they should be banned from using a product, which Congress has so far deemed to be legal. If Congress were to ban smokeless tobacco, the Players Association would not object and might even support such a measure. Would the Players Association agree to ban smokeless tobacco in baseball as part of our next round of collective bargaining negotiations? We're a union. We pride ourselves on having a democratic structure and a democratic process, much like this Congress. It's up to the players, the members of this union, to decide what issues they want to bring to the table. I can guarantee you that I will bring back to the players the concerns that have been raised here today, and I'm sure more will be raised, back to the membership of the union, and that this issue will get a full airing. That's how a union works, and that's how collective bargaining works. Lastly, since this is the Health Subcommittee, I want to raise with you another health hazard that affects our members and the public at large, and that's the issue of dietary supplements. Simply put, the existing regulatory scheme is not working. There are many quality products on the market, but there are also many that contain dangerous ingredients that aren't labeled as such. In fact, the Food and Drug Administration just released a list of over 100 dietary supplements that can be bought over the counter that contain performance-enhancing substances which are banned under baseball's drug testing program. Our members have suffered the consequences by testing positive and receiving suspensions as a result of ingesting these products that contain such unlabeled substances. We realize this may be a politically sensitive issue for some on this committee, but without your help, millions of Americans, young and old, athletes and non-athletes, will continue to be at risk for taking supplements that contain steroids, pharmaceuticals, and other dangerous substances. We hope that you will give this issue as well the attention that it deserves. Thank you for your time. I'll be happy to answer any questions at the conclusion.
Thank you. Mr. Garagiola.
Thank you, Chairman Pallone and the committee. And
I think your mic, you have to bring it closer and yeah.
Turn it on.
And there we go.
Never been around a microphone before. Don't know what to do. I just holler. You're not going to hear a bunch of numbers from me. You're not going to, and don't start the clock yet, because I got all kinds of notes here on my paper. These guys come with typewritten sheets and all that. But I made some notes after listening to this. $650 million. When we started out with, and I hate to hear that word smokeless, that belongs to the tobacco companies. It's one of the harm reduction. I could use a word that would get me kicked out of a game when I hear that, but I will not. I watched 60 Minutes like you did, and it was scary.
let me just throw a few things out. In 1993, and I keep hearing numbers, and it's true. In 1993, 21% of the players in the World Series used tobacco, spit tobacco. That's what I call it, spit tobacco. That's what it is. In the year 2000, 7 years later, it was 0. Why was that? Because I was in the trenches with a bunch of guys who went with me. And I called the producers. I said, why do you guys stay on that shot? Get off that shot. I called the guys who, the president of the networks, Lenny Dykstra, who was the poster boy, just to give you a story. I went up to him. I said, Lenny, why do you use that garbage? What do they give you? They give you any money? He said, no, I have to have it. Why do you have to have it? I just have to have it. And I said, just tell me you won't use it during the World Series. I'll talk to my guys at CBS, and we'll make an impact. No, I can't do that. Lenny Dykstra has quit using it, guys, because he ran into a problem. So I don't know about numbers and all that kind of stuff, but I just want you to know that that's where it got started. $650 million. When I was with NSEP, I made speeches across this country. I'll never forget going into Connecticut with the Attorney General. And that's when the tobacco company, they were going to use it as a safe alternative to cigarettes. Oh, come on, give me a break. I'm not going to go through all this. I'm just going to tell you some of the things that I have learned. In my day, we called it chew. I chewed. Why did I chew? Because the other players chewed. I thought it was part of baseball, and that's what it's all about. I mean, the things that you do because the other guys do it. They used to give us salt tablets. Salt tablets they used to give us. I think they were trying to kill us is what I thought they were trying to do. But it has improved so much. And now, I got so much I want to say I'm choking on myself. Like many other players, I thought being a major league player you had to chew. You watch those guys, Lon Warnicki, who I grew up with, that kind of. I chewed until my daughter came home from school one day and said, Daddy, are you going to die? I said, sweetheart, sure I'm going to die. We're all going to have to die. She said, I mean, are you going to die? I said, yeah, but not now. I'm not looking forward to it. And she said, no. And she had that look in her eyes. And I said to her, sweetheart, why are you asking me? And she said, because we're studying about tobacco, and we were studying about lungs, and they said if you use tobacco, you're going to die. I stopped. I wish you guys could walk with me on a field, because I have been called everything from a Nazi anti-tobacco chew zealot. I mean, come on. This is what these ball players do. I mean, forget the numbers and all that. Get in the trenches and watch them. And with the minor leaguers, baseball has done a great job, and baseball's taken a beating here. They really have, and I'm sitting next to the guy that I want to romance here, put some chapstick on and get him to do the job. But to me, in my 20 years of working to spread the word about the dangers of smokeless tobacco, many of my friends, Jack Kroll, a coach, he lost half his tongue like my friend Gruen. I have a tape here, and I'm all over the place, I know. I'm going to tell you about this tape. This is Gruen von Baron's tape. And if any of the people on the committee would like to have a copy, we will get it to you. I'll get it to you. The Diamondbacks paid for this. We didn't have any of that $650 million. Here's a booklet that Bud Seeley, the commissioner, gave out to people. And I mean, it's nothing but little cartoons that kids can see. Here's one. It's easy to quit smoking cigarettes. You just take them out of your mouth. No, Daddy, let's make him a non-smoker. He's working on a snowman. He'll last longer. I mean, I was begging everybody to help us, and they did. But I lost Jack Kroll, lost part of his tongue, couldn't talk, and in a year he was dead. Bill Tuttle. Bill Tuttle died one piece at a time. Bob Leslie, a high school coach. And I never asked anybody to make a tape or a DVD. Bob Leslie called, and he said, Amy and I will want to make a tape. And we went out there and made this tape. And I'll never forget when Bob Leslie died. I spoke at his funeral. And here was Amy right where that chair is, the second chair, holding a baby. And I said to myself, in her 20s, holding a baby that can't even stand up by himself or walk, she should be enjoying it. And instead of being a mother and a wife, she's a widow. Hadn't even seen 30 years old. They all died too soon. That lit the fire, guys. I want to tell you, that lit the fire. And that's why I agreed in 1994. That's how long I've been going out there. And I never got paid a nickel. Never got paid a nickel. I didn't want to get paid. They wanted to hear my speech. They had to pay my flight there. And I'm going to tell you, sitting in the middle seat sucks. But that's not in the script, by the way. But anyhow, I agreed to chair the National Spit Tobacco Education Program. And we had some money from the Robert Wood Johnson Foundation. I've worked with them, and now I haven't heard from anybody. It's almost like I got leprosy. Anyhow, I lobbied Major League Baseball to ban the distribution of tobacco products in Major League clubhouses, a rule that's still in effect. And I'm going to tell you how that started. Rob knows it. I went to the Diamondbacks, and I said to him, you guys hire the clubhouse guy. Tell him he can't put that tobacco there, and don't let the tobacco companies give you free tobacco. And kind of looked at me, and he said, well, what do you mean? I mean, clean it out. Let them stop. Make it inconvenient to buy the tobacco, which they did, and that was good. But you know what? When a kid comes up from the minor leagues, he knows he shouldn't use it, but I see it. The first thing they do, they don't even pick the bat first. They throw a chew in their mouth. We have to educate, educate, educate. And Commissioner Seelig is behind it 100%. Hey, U.S. Tobacco, if you look at it, they don't call themselves a U.S. tobacco company anymore. They're a U.S. Smokeless Tobacco Company. Now, if that isn't a subtle commercial, I don't know what is. I have letters from Commissioner Seelig and Donald Fear, both, who are backing what I'm doing. Why can't baseball and the Players Association right here get together and ban it? Take it off the field. I think it was Mr. Waxman who said something about we don't see a player going up there with a cigarette in his hand. I know where he got that line when I testified before his committee. I mean, Arnold Palmer used to play golf, walk on the green, flip a cigarette, and putt. But we don't have that in baseball. Tobacco is tobacco is tobacco. Get together, the Players Association, baseball. Get together, guys. Ban tobacco, and anyone who uses it is penalized. I don't care if it's a suspension. I don't care if it's fines or what. Get it out of our game. It's a great game. Greatest game going. I've heard all kinds of things about it. Let me find my place again, guys. Stay with me. We have, oh, I almost forgot the most important thing. We have a club in Arizona that I went to the Diamondbacks. And I said, you know, why don't we let the kids in free? I wanted to call it, let's kick their cans. And this is what Bill Keene did for me. We call it the No Chew Crew. And they get a red T-shirt with No Chew Crew, and they sign a pledge that they're not going to use tobacco. Well, you don't know if they're going to use it or not, but they're going to be aware of it. But they get into the game free if they come chaperoned. This is Gruen von Baron's tape. We got this in every school in Phoenix, Arizona. How I'd love to see that in every school in Arizona, the whole state. Spit tobacco. I would like the players, and boy, do I get it from them, who are role models. I don't care what anybody says. Whether they agree, Charles Barkley notwithstanding, they are role models. I want them to quit carrying a can of dip in their uniform pockets, especially where the youngsters see them. I just had an incident last Saturday. I did a broadcast. I'm just getting out of surgery. I had 3 major surgeries. I didn't work at all last year, and I was in a hospital all of 2009. But when I got this invitation, that's how important this is to me. I was in the Diamondback clubhouse, and one of the players, I don't want to name him, he's sitting there with the laptop, and he's dipping. I go around the corner, and they got a kitchen now. We never had a kitchen. If you had a bologna sandwich, you were lucky. These guys sit there and watch the Days of Our Lives or whatever instead of taking batting practice, and then they wonder why they can't hit, and they're going to be broadcasters. But I saw him using that stuff. I said, why are you using it now? Oh, it feels good. It feels good until they find something. I can name players. Kurt Schilling, we took him in for a brush biopsy that Rob was talking about. He came out, he was as white as his towel because they found a lesion, and he had to have it biopsied. Kurt Schilling, who pitched in the World Series. I don't know if he's using it again. He may or may not. But it is a deadly, addictive habit. And it's an uphill battle, this spit tobacco. And I'm going to tell you why. Nobody has mentioned it, but I will. I have made speeches before the firefighters, police officers, anyone who works with the public. They can't smoke. They can't smoke. So what do? They use spit tobacco. And when I told them about it, and the reaction that I got was tremendous. And they start early because the tobacco companies advertise them at a very early age. These companies mislead you. You want to talk about advertising? Here's a catalog that they put out, okay? I know you got a bunch of books there, Chairman. I'll give you this if you want it. In fact, one of them got me mad. Brad Rodeau. Brad Rodeau is from the University of Alabama, Birmingham. He's on the payroll of the tobacco companies. So if you want to burn it, you can burn it. You got my permission. Here's a catalog of gifts. Here's a pool table. You know how many lids you need to get this pool table? 10,000 lids. You use 10,000 cans of tobacco, you'd have cancer of the feet. And that, you know, they talk about cowboys and westerns and all that. They do that. We were at a NASCAR. One of the people here talked about NASCAR. I went there, and we put a sign up there. Smokeless does not mean harmless. They came and said that it was insulting to them. I said, insulting? I can't believe it. And they made us take it down. It's not a safe alternative to cigarettes. Fewer people die from it. That's the song of the tobacco companies. You know what it's like, and this is what I said to the Attorney General in Connecticut. It's like saying, don't jump out of the 50th floor. What are you, nuts? Jump out of the 30th floor. You got 20 floors on your side. The result's going to be the same. It's a dangerous, deadly habit, and baseball can't solve the problem by itself. We need help. Players Association, Commissioner Seeley encourages everything that I do. Donald Fear, he's gone now, right?
He's still around, but he's retired.
He's retired, but you're here.
I'm here.
Okay, all right. You go back with this message. Let me just say this. We need truth in advertising. That's important. I can't think of the congressman's name. He was from California. He called me and he said he's going to have a press conference in California, and could I get a ball player because he wants to have stronger words on the can. And I wasn't too smooth with him. And I said, is this a photo op or you really mean it? He said, no, I'm really going to do it. And I said, what are you going to do? He said, make a stronger message, black print, big print. I said, okay, I'll get Karis. We came out there, a kid named Mike Watson from Denver. He's a firefighter now. Kid was on a Friday. He quit. Monday, he went back to using it. And, well, what can I tell you? Smokeless does not mean harmless. I don't know what my time is, but I'm very emotional about
Your
this.
time is up, but we appreciate the fact that you
But I
went
got
on.
something more I want. Never mind.
All right. Thank you so
Thank you
much.
very much.
No, I appreciate the fact that you spent so many years dealing with this and trying to make a difference, and I know you are making a difference, so thanks a lot, really. I appreciate it. And we'll go to Dr. Connolly.
Thank you very much. And it's really hard playing cleanup witness to Joe Graggiola, believe me. I did have the opportunity to testify 25 years ago before Mr. Waxman on this very issue, and I think the only difference I can see is that at the time Mr. Waxman had no hair and I did have hair. I am a dentist. I teach at Harvard. I had the opportunity to work with Major League Baseball Players Association for 3 spring trainings and conducted surveys on why they used the product, also did examination of their oral cavities. Now, I just want to go through with what the players are at risk. If I represented a union, I would be concerned with the health of my union members. The Teamsters put efforts into protecting the health of their union members, and I think other unions in the United States of America should worry about their union members. I'm just turning over here. If you take the dip out, you see something called leukoplakia. This is a grade 3, and I used to have a game with the Blue Jays. I can guess how many dips you use a week game. And just by looking at these lesions, you can identify is it 1 can, 2 cans, 3 cans, 4 cans. I remember one player said, "I beat you, Doc." And I said, 1 can. I said, "Look over here. It was 2 cans here and 2 cans here." San Francisco, University of San Francisco, screened 52 players and found 2 precancerous lesions in those white lesions. And those are precursors to cancer. They're present in about 50% of the players. The players tell me they want to stop, they can't because they're addicted, and they're doing it in spite of a known health problem. Next, so could someone just turn that over for me, please? This is another famous baseball player who spent literally $10,000, just pick that darn great, to treat another condition. This is where the nicotine and the ingredients get in and destroy the bone tissue. He had to have grafting, and unfortunately, mid-level of the season, he's back using again. Next slide, please. Next. And then this is use rates. We monitor use rates over time, and we see about 1/3 of the players use it. Minor leaguers less, maybe because of the ban with minor leaguers. I'm really not sure, but this really hasn't changed. So we're still seeing players at risk of developing disease, not during their careers in baseball, but most likely later in baseball. And I think you've got to protect the health of the players. That's the basic element here. Next slide, next set of slides, please. So then we also looked at reasons why the players used it. I asked them, we did a survey among 556 players, and the respondents who were heavy users primarily used reasons for addiction. It was for, I was hooked, I was treating relaxation, withdrawal. Not one player said, I used it to enhance my performance. Players are not proud of using this, and that's a reality. They wish they didn't start as little leaguers, or as high school ball players, or as major league, or as minor league ball players, but they're hooked. Next slide, please. Well, we can stay there. We estimated use over time, and it's been about 9 minutes of game use from 1987, 86 to 2004. Hasn't changed. What has changed is the use now is being concentrated by a handful of players. It's only 1 or 2. The vast majority of baseball players do not want to be bad role models. And the only way one is going to deal with those 1 or 2 players, and I can just look at, you know, we banned advertising through the MSA. We banned it through the FDA Act. But all you have to do is pick up the front of Sports Illustrated. And fortunately, this guy is wearing a Dodgers uniform and not a Red Sox uniform to see what type of advertising reaches kids across America. I told the Jays, I said, you know, if you, based on the use you use just in the World Series, that equals the salary of the entire club. And you guys are deemed to be greedy by Americans? And one guy got up and said, I'm going to call my agent. I'm going to call my agent. And it's spreading. This is Facebook. We're seeing dozens and dozens of groups on Facebook with high schoolers extolling the virtues of using smokeless tobacco products. And it's all related to Major League Baseball players. We see 2 groups on steroids, one opposed and one saying maybe it's okay. But we're seeing widespread use of adding the drug nicotine to users. Next slide, please. You know, when we take an oath as health professionals, we take an oath to do no harm. That's called the Hippocratic Oath. It's not an oath to do less harm. I want to make that perfectly clear. We take an oath to do no harm. We have medications called Nicorette that are outselling these newer products 1,000 to 1. They're being used effectively. They're approved by the FDA. They increase quit rates. They double quit rates. And they don't have cancer-causing chemicals in them. We have tens of thousands of baseball fields across this nation. And it's banned on virtually every one except 30. Yet those 30 fields are the most important fields to the health of American children. Only those 30. You can't dip in high school. We get NCAA to stop it. Major League Baseball stepped to the plate and stopped it. And we have a problem right now in America. We have a problem in America. And that's protecting the health of the union and letting the members do what they want to do and not be victimized by one or two players who think somehow it's glamorous to throw it in your mouth and look like who knows what. I want to thank you very much for giving me the time to testify. And the last time I was with Joe was at the Red Sox game where he announced the whole gang to me and my son, and it was a wonderful experience. Thank you, Mr. Chairman.
No spit tobacco either.
Thank you, Dr. Connolly. We're going to take questions, from the members, and I'm going to start with myself. And I'm not trying to be difficult in any way, Mr. Prouty, but I guess you took a lot of time to explain, that the smokeless tobacco, is essentially banned in, I think it was you that said in minor league, but you said in major league it's not, and you cited the fact that, basically it's legal, and so, why should we be pressured or whatever, I guess, to ban it? But I mean, it's obvious that you ban a lot of other things. It says I guess players aren't allowed to open a beer or mix themselves an alcoholic drink in the dugout, and also you ban the smoking of cigarettes. Or Major League has banned the smoking of cigarettes in uniform view of the public. I mean, cigarettes are legal, alcohol is legal. What's the difference? Why is it so important to continue the use of smokeless tobacco, but not these other things? Why is it any different?
Well, Congressman, first of all, let me say that there is a difference between cigarette smoking and smokeless tobacco insofar as smoking affects the game. You can't smoke while you're playing. Cigarette smoking also has secondhand effects on other players. But I don't think we're here today to say that to defend smokeless tobacco. What we're saying is that it's a legal product and it's legal in the United States for use. If you want to go about banning it, Congress should go about banning it.
Oh, no, I understand that, but yes. I guess what I'm saying is that it just seems strange to me, I guess when you negotiate a collective bargaining agreement, why is there not an effort to say, pursuant to the collective bargaining agreement, that smokeless tobacco would be banned as well? I guess I'm asking from the point of view of the players as well as from the point of view of the union. It doesn't make sense to me that you'd have a lot of, that you wouldn't press to do the same thing. Is this coming from the players? Are they demanding that it not be prohibited? What's the reason?
Well, in any organization there are varying views. We have people who are all for using smokeless tobacco. We have people who are against it. We have a round of collective bargaining negotiations coming up. We can only look forward on this. We are just beginning to formulate our proposals on all kinds of issues. I'm not the union. We represent the players. The players will get together and decide what issues to bring to bargaining. Mr. Manfred's side will get together and decide what issues they want to bring to bargaining. As he said, smokeless tobacco is a mandatory issue, so if either side brings it up, we've got to talk about it. We hear what you're saying. We will take the concerns of everyone here back to the players. It's for the players to make a decision about what to go ahead and bring to the bargaining table, but rest assured I will make sure, based on the hearing today, that they hear what you're saying.
No, I appreciate that. And then I wanted to ask Mr. Von Buren, again, I appreciate your being here today. When you said that you've reached over 2 million kids in the course of your speeches and presentations, that's really amazing. But I wanted to go back, when you talked about your, you mentioned when you first started using the tobacco, and how much did your decision to start and use correlate with your passion for baseball, which actually you have? And do you think that if you had known more about the health effects when you were a young person, you still would have used it?
You know, I tell kids every day that if somebody like myself would have came and spoke to their school or to my school whenever I was a young man, there's no way I'd be sitting in front of you guys here today, because I would have made an educated choice and I would have stopped using. This would have scared me enough into not using these products. And you know, baseball had, like I said, a marginal effect of why I use tobacco, guys. We're sitting here today and we're talking about baseball and spit tobacco, and yes, I believe that they should not be able to use it on the field. You know, that's just like smoking a cigarette on the field or whatnot. I'm not going to get into that because that's not the type of person that I am. But there are so many other things that we're overlooking. I'm a competitive bass fisherman. I fish all over the Midwest. There's boat trapping tool ads. There's boat trapping Longhorn tobacco ads. The guy who got second place in the Bassmasters last year fished out of a boat sponsored by Longhorn tobacco products. So there's so many other forms, and there's a lot more of these types of people out there than there are potential baseball players. There's more hunters, there's more fishermen, there's more just farmers, kids, people who aren't really that associated with baseball are being affected by the advertisement and this ploy that tobacco is a safer alternative to cigarettes.
So you're convinced that if we had more education and awareness, a lot of these young people would not start using it?
Definitely. And you know what? It irritates me when we talk about education, because there are so many budget cuts that you'll in effect across the United States. There's people out there fighting to do their job to prevent you from using these products. They can't even do their job anymore because somebody wanted to build a road with the money donated to them from the Master Settlement Agreement. So we need to first make sure that the Master Settlement Agreement money goes into education, what it's meant to be used for, not to fish the road, not to get somebody out of trouble, to educate youth. And if we educate youth, I think in the long term, we'll see our health and our financial being get better. I spent almost $3 million in medical expenses from what this product did to me. $3 million to have surgeries, to have the radiation treatments, to lay in the hospital for 2 months at a time. $3 million. I don't know of one person who will spend $3 million or how much taxation you'll make off of one person in the lifetime of selling of this product. It's a very harmful, addictive drug, and we just need to put guidelines in and make it better and make kids understand what it can do to them.
Thank you. Mr. Shimkus?
Thank you, Mr. Chairman. Mr. Von Buren, you made Illinois proud.
Thank you.
I appreciate you coming, and Mr. Gragiola, of course, you made St. Louis proud.
Hey, before you start,
yes, sir.
I have this DVD. It's the best piece of equipment I have to talk to people. It's all about Gruen and nobody else. And he talks to high school kids. And the Diamondbacks were good enough to make sure that it was distributed and the schools got it. Gruen was great. And I wish you could see the effect he had on the young people. Because when he walked out there, there was a collective, and then he started. And boys, he knocked their socks off. I'll never forget that, Gruen.
You know,
Would the gentleman yield, and I'm not going to take away your time. I'll give you more time. What I was going to suggest, Mr. Gargill, is that if you have or can get us extra copies of that, we'll circulate them to the members of the committee.
You tell me how many you want.
Yeah, we'll get back to you. And also, I don't know if there's a transcript of it. We could enter that in the record, but we'll look into that. All right?
Well, I'll tell you what, you can't. I'm going to give you that and the Bob Leslie tape. When I asked Bob Leslie, what's the toughest part of the day?
Okay. Thanks.
And I want to, let me just follow up on that. You did talk about the No Chew crew program
Right.
with Arizona. Has that been accepted or replicated in any other the ballpark organizations and stuff?
I have been frustrated.
I mean, like the St. Louis Cardinals.
A lot.
Pick that up.
I'm going to answer that question as honestly as I can. Only one other club called the Diamondbacks and said, tell us more about it. That was the Marlins. Okay? And nobody else. This booklet, I want to give it to the little guys because I thought they could read it, and because it's a tobacco message, but they could also color it. And Commissioner Seelig, he gave me $50,000 to make the distribution. One club, and I don't want to embarrass them, the girl says, oh, I'm going to throw them away because we don't have any room to store them. I said, no, you're not going to throw them away. I called the president of the club, and we got them distributed. No, it was met with industrial strength apathy.
Dr. Connolly, when you talk about the addictions, I believe there's social kind of addictions, peer pressure. Are you making a determination between social kind of addictions, the peer pressures, or the physical addiction?
Well, I think we have to understand that you have two different dosing mechanisms for nicotine. With a cigarette, you get a rapid dose of nicotine and it falls off. And so that's a spike effect. That's very, very attractive because it's reinforcing and it has central nervous system effects. With smokeless, it's a slow effusion across the oral cavity, about 20 cell layers, and you get a general background dose. Now with a product like Copenhagen, you get a bolus of nicotine into the central nervous system. So it is a chemical addiction. The Surgeon General will describe it as such. And then we look at quitting patterns. We find that it's about the same. It's equally hard for smokeless tobacco users and cigarette smokers to quit. They're about the same because they're dealing with a chemical addiction. Finally, what is disturbing is the increase in dual use that we're seeing. One player, well, not players per se, but in the American public, people using cigarettes and using smokeless. And what we may be observing is the emergence of dual dependency, someone being dependent upon cocaine and heroin at the same time. It's extremely hard because of the difference in dosing to treat dual dependencies. And so this is what I think a major concern we have for the nation is that young people seem to be using both now, in particular parts of the country, and it's going to be harder, I believe, to treat those dependencies. Let me point out, too, the Players Association have to step up to the plate here. I mean, we got to stay.
Yeah, and my time's.
Yeah,
I'm going to address that, and I want to. We've been here a long time already, but I do think my colleague from Maryland, it does make sense if you've got a asset, as the Players Union does, and as Major League Baseball does to protect the asset. I'm a Republican. We believe in competitive markets. We want to protect collective bargaining, and we want you all to work it out. I'm not one to want government to intervene with a national law to say, because if we had banned tobacco products, then we'd have the underground economy. We'd have the products, just like we have illegal drugs, et cetera, et cetera, et cetera. But it's always better, gang, if you do this and work this out. And I think you hear a collective agreement by the panel that we would hope that in the next round you all would step up and lead by example, and then you wouldn't be called back up here anymore for this case, for this issue. So,
just quickly,
yes, sir.
I'm saying there's no silver bullet here. We need education for the kids, education for the players. We need treatment for those players. We need counseling. But we also need policies. You can't say one is going to work and the other without the other. It's a combination of efforts.
Well, and Mr. Von Buren mentioned the family and leadership. It's not just professional sports. It's family. I caught in the hot summers of St. Louis, and my parents gave me salt tablets because of sweating, and they thought that was what was thought at the time. We all educated.
Trying to kill you, I told you.
Maybe they were. They found out I became a politician. They realized they should have taken away me earlier. But we do appreciate your time and effort. And Mr. Chairman, I'll yield back.
Thank you. Chairman Waxman.
Thank you very much, Mr. Chairman. As I understand the situation, if Major League Baseball wanted to ban the use of smokeless tobacco or cigarettes, they can just go ahead and do it when it comes to the minor leagues. But when it comes to the major leagues, they can't just go ahead and do it because you have to have a collective bargaining, the union represents the players in the major leagues, but not in the minor leagues. Is that right, Mr. Prudy?
Prouty. Yes, that's correct.
So the only way you would get to talk about the major leagues would be through collective bargaining agreement.
That's correct. It's a mandatory term, subject of bargaining.
Okay, so you have to bargain this question out and have it as part of your contract. Mr. Prudy or Mr. Manfred, do either of you disagree with the harm that comes to the players after all the testimony you've heard today from the use of smokeless tobacco?
No, Congressman, we don't disagree at all.
Okay, and Mr. Manfred, you don't disagree, do you?
No, as a matter of fact, we've put extensive effort into trying to encourage our players at all levels, minor and major league, to not use smokeless products.
Do either of you disagree with the idea that children, young people, are influenced by seeing behavior of players on the field? Mr. Manfred?
No, I don't.
No, we don't disagree. Players are role models. We don't dispute that.
So then the question is, if there are health risks to the users, and if there's a problem in the message that's sent to the kids, and you seem to both agree with that, wouldn't you both be in favor of agreeing to not allow players to be using smokeless tobacco on the field?
Well, Congressman Waxman, it's not as simple as Mr. Manfred and me just agreeing. We both represent constituencies.
Mm-hmm.
The union's a democratic organization. Mm-hmm. We have to go back to our members. We have to hear what...
I understand that. What would be the argument against it from the players?
The argument against it is that it's a legal substance which can be used in this country.
So are cigarettes.
So are cigarettes.
Your members don't want to reopen that issue, do they?
No, they don't.
So you have two legal products. Nobody's disputing that. How about drinking beer or other alcoholic beverages? Perfectly legal, may or may not be harmful depending on the circumstance. Right. Do any of your players think that they ought to be allowed to drink on the field?
No, they don't. I don't believe so.
So I'm trying to understand an argument they might make on smokeless tobacco. If it hurts the health of the players and it influences adversely kids to use a product that's going to harm their health, I would hope you would take back to your members that they shouldn't stand in the way of what Major League Baseball did when it came to the minor leagues and put in the same policy for the major leagues.
Absolutely, Congressman. You can be assured we will take back the concerns that we've heard here today, and the players will consider that along with all the other issues, and we will bring it up in the next round of bargaining if that's what they decide to do. It's a democratic organization. So I can't promise you here today it'll be brought up. I can promise you that I will bring back and make them understand, as we did with steroids and other issues you're aware of, exactly what Congress feels about this.
What if your players said to you, I don't want to have a ban on steroid use because we think it helps us improve our performance?
Well, I don't want to...
Would the players advance the argument in the collective bargaining agreement that there shouldn't be any ban on performance-enhancing drugs?
Congressman, that's not where we are. As you know, we went through a series of
I remember. I remember it well. Well, I'm just obviously pointing out the illogic.
But no, I understand that. But if you remember, the process that we went through every time was we went back and held meetings with players and developed a consensus about this is what's got to happen, these are the risks, this is the testing program, and frankly, if we don't act, Congress is going to act, but we'd rather settle it by collective bargaining. And in the end, that's what we did, was settle it by collective bargaining, and you endorsed what came out of that.
Let me ask you if you will be willing to start this process of consultation with your members now so you can be ready with a consensus position to allow this to be part of the collective bargaining when your contract's next up.
Yes, we will. We will, as I said before, bring this back to the membership and start consulting.
Good. Thank you very much, Mr. Chairman. I appreciate everybody's testimony today.
Thank you, Chairman Waxman. Gentleman from Indiana, Mr. Boyer.
Thank you very much. I want to agree with the comment, educate, educate, educate. I think you're right. And in a free society, I believe there are always going to be differences of opinions based on differing values, beliefs, perceptions, and also due to the imperfections of reason. So in the effort to educate, we also have to nourish the hope that how do we achieve improvements to public health? Now, when you make that effort, you cannot ignore science. Now, what was challenging from the first panel was to have an individual who would not acknowledge that there is a continuum of risk among tobacco products. Now, I don't smoke. I don't advocate for people to smoke. I also recognize that it's a lawful adult product and that it's a product that we don't want in the hands of children. So I also acknowledge as a worthy effort to prevent role models from using such a product, and what can we do to make sure that children don't gain access? Well, you know, we've done a lot of things. Not only have we made it illegal for individuals under the age of 18 to gain access to these products, but you know what? The Master Settlement Agreement. I'm surprised by the advocates at this panel that you haven't talked about the Master Settlement Agreement and the fact that the states out there are not utilizing monies collected not only from the MSA but also from cigarette taxes to be spent on education programs. So in fiscal year 2010 alone, and this is according to the document that I've had now submitted to the record titled A Broken Promise to Our Children, it states that in the current year of fiscal year 2010, states will collect $25.1 billion from the tobacco settlement and tobacco taxes, and they will spend just 2.3% of it, which is approximately $560 million, on tobacco prevention and cessation programs. Now, when we passed Mr. Waxman's bill, I had offered an amendment. I'd offered an amendment for us as a nation to improve public health, to acknowledge the continuum of risk, and is it possible to migrate people from smoking to smokeless to finally quitting? Is that possible? When in fact there is a crucible out there for which we can look at, which is called the Swedish experiment. Incorporated in that amendment was also this, the advocacy on behalf of Ms. Blackburn to actually state that, you know, states, you should be required to spend a portion on education, a portion of the MSA. That was defeated. That effort was defeated here on the committee. And it should not have been. Because of those of whom will acknowledge and actually say that smoking a cigarette is just as bad as utilizing a smokeless tobacco product, ignores science. Because there is truly a difference in the continuum of risk. Now, I don't advocate the use of either of those products. But to say that a snus product that eliminates 99% eliminates nitrosamines, and you've got a 1% of health risk versus the 100% from a cigar, ignores science. And so it's challenging for me because I look at this and say, I agree with the testimony of educate, educate, educate. But why would the advocates of abstinence then not be willing to educate tobacco users that there truly is an opportunity to lessen the risk? That if you can reduce the thousands of constituents and toxins from smoking to move to smoke less, that in fact can make you healthier. But the complete goal here is actual cessation of the tobacco product. To ignore that is also then to ignore science and ignore the advocacy to educate, educate, educate. A nation cannot be ignorant and sustain freedom. So as a government, when you ask governments for its help and assistance, we as a government need to be honest with regard to our advocacy with regard to availability of tobacco products. Now, for those of whom are advocating abstinence, if you want to advocate the complete outlawing of tobacco products, go ahead and say that, if that's what the advocacy is. But that's not what this committee has chosen to do. It's not as a country for which we've chosen to do. So I want to thank all of you for your efforts. It's unfortunate with regard to Major League Baseball and the Players Union that my sensing is that you've been brought here to testify and that the committee is somehow strong-arming you with regard to what should occur or not occur within collective bargaining. I think that's wrong. If we're going to actually say that the marketplace is a sacred place. And so that's unfortunate. You can choose to do what you believe is morally right. And I believe that you have that sense. And that can happen at the table. But for us to strong-arm you and to dictate as to what you should and shouldn't do and supplant our moral understanding upon you, wow, if that's in fact what we want to do, then we should have made tobacco products illegal instead of passing that bill. With that, I yield back.
Could I just comment?
I think we should probably let them respond.
I'm sorry.
If they want.
Yeah.
I did not ask a question. I yielded back. I made a statement.
As a person.
All right, he's yielded back, Dr. Connolly. So, Ms. Blackburn.
Thank you, Mr. Chairman. And mine is more of a statement than a question. I do appreciate that all of you are here. And Mr. Boyer mentioned some of the frustration that we have with this issue. As I said in my opening statement and in my questions in the 110th Congress, in the 111th Congress, there was an opportunity to expand SINAR and to take care, special care, extra care, to address this issue of teens and smoking. Now, I was interested in the testimony of a couple of you, Mr. Manfred in your testimony and Mr. Gargiola in yours. You talked about education and the importance of education and why this needs to be expanded. And I liked the example of the No Chew crew.
But you need money.
Okay. Then is this a program that would function well with some of the master settlement dollars? Have you looked at that? Are you seeking to move forward with expanding that program through the money is there. I mean, that's...
The money is there, but I think it's in... I have a clipping that I've saved. This is from 2001. In North Dakota, legislators have been criticized for considering using a portion of the settlement money to build a state morgue. In Alabama, legislators allocated a portion of the settlement to fight gangs and satanic worship in public schools. In Montana, officials funded a juvenile delinquent boot camp. Tobacco-growing states like North Carolina, South Carolina, and Virginia, funds have been set aside to compensate tobacco farmers for losing crop revenues as smoking declines. The problem comes when you call these people. Mike Moore, the Attorney General from Mississippi, we thought we had the money. And when you call, the line is busy, they'll get back to you. I'm still waiting for calls from some of these guys.
Well, and the legislation I've brought before this body that action was not taken on would have addressed the usage of some of these master settlement funds and would have required the states to meet certain expanded criteria. There is a way to address this. Mr. Manfred, I think you had a couple of thoughts, and I do appreciate your testimony. And when you talked about the minor league policy that is there on smoking and tobacco products and the compliance rates on that. And I wanted to know if the smoking cessation counseling programs that are provided by the club's employee assistance personnel, to what extent that has been successful, and if you all are doing outreach specifically geared toward children.
Let me start with the employee assistance programs. I think that when you talk to our employee assistance professionals as a group, the 30 of them, we get them together twice a year, and I think that in all candor, they feel that they have very good programs. They feel that they have a moderate degree of success, and the single biggest frustration that you hear from them is people go through the programs, they do well, they stop, and then they return to use. If I had to summarize what our very long discussions with this group, that's how I would summarize it. In terms of outreach, Major League Baseball has been committed to the N-STEP undertaking for years and years. I think Mr. Garagiola referred to the fact that Commissioner Seelig allocated $50,000 recently for a specifically child-directed program. He's holding up the pamphlets from that program. Commissioner Seelig himself sees this as a public health issue. I think that it's fair to say that our efforts in this regard, both internally and externally, will continue.
I appreciate that. I will just close by saying, from our perspective, there has been an opportunity to address this. We have legislation. The SINAR language has worked. We don't need to reinvent the wheel. The goal is to make certain that children are educated and realize the dangers of tobacco use. As a mom, as a former Lung Association volunteer, as the former president of that board, the education programs have been vitally important, and that is how we're going to change this. And there does exist an avenue for that, and I think it's regretful that this committee did not take up the opportunity to address that. And I would have preferred our time today be spent on some other components that addressing some things in the health care bill that need to be done, or addressing getting a federal budget together, which I am understanding the Democrat leadership in this body does not want to do. With that, I yield back.
Thank you. There's only a few of us left, so I want to, we're just going to have a second round for whoever wants to ask questions, and I'm going to yield myself some time. I asked Mr. Prouty before about a commitment, to bring this up, and I think Mr. Waxman did also, to bring up the issue of smokeless tobacco, in the context of collective bargaining agreement. And I just wanted to ask Mr. Manfred the same thing, if you'd be willing to say that you'd make the issue of smokeless tobacco a priority when you negotiate with the players over collective bargaining. Would you and the commissioner fight to try to end the use of smokeless tobacco used by major league players? I mean, I know that you don't have, a lot of this depends on what happens, but we're still trying to at least get you and Major League Baseball to say, look, we'll try to make this a priority. We'll bring it up. We're committed to putting an end to it in the same way you have with the minor leagues.
We've begun our preparations for 2011 already. I think that Commissioner Selig's directive that Dr. Shaha make a presentation to the Safety and Health Committee is indicative of his commitment to the idea that this issue needs to be addressed in 2011. I can also tell you that in our conversations with individual teams, we've had a number of teams raise this issue as something that we need to be putting on the table in 2011.
But I mean, can you just go beyond that and say that it's a priority for that purpose?
I can say, certainly I can say this, that for Commissioner Selig, it is a priority in terms of the issues that we've discussed so far. I think that's an accurate statement.
I appreciate that. I'm going to yield back and ask Mr. Shimkus if he'd like to say anything or ask any more questions.
No, I just appreciate the panelists. I think my colleague, Congressman Blackburn, makes a good point. And I would request that maybe the full committee chairman bring in the states and ask them to use their master settlement money on the tobacco to print your brochures, to print the DVDs, and get them in all the schools across the country. That might be a good use of that instead of some of the other things that Mr. Garagiola highlighted in that old article. And I mean, if we're serious about educating, we ought to be about the business of educating. And I appreciate those who are doing their part with their own ability. But again, I think government has dropped the ball on some of this aspects, and I yield back my time.
Mr. Boyer? No additional questions? Okay. All right, let me thank all of you, really. I thought that this was very worthwhile today. It's obviously an issue that Mr. Waxman in particular, but many members of the committee have cared about for a long time. And I also appreciate the fact that some of you, are willing to take it back, with the major leagues and try to address it. I think it's very important to us. So thank you very much. The way we operate is that you may get additional written questions within the next 10 days or so that we'd also ask you to respond to as quickly as possible. But thank you. And with that, the subcommittee hearing is adjourned.
going to make you chairman of the committee to raise the money for the No Chew crew. How's that?